Facebook. Facebook, hold on. I got to fix something. I'm not a computer geek. No, I am. No, I really am. But anyway, okay. So, like, seriously, hold on a sec. Hey, Facebook, how are you guys doing today? How is your sound? How is the sound right now? Yeah, you know what? My Facebook sound got messed up. All right, Facebook, hang tight. I'm coming right back. I got to restart stream on Facebook. 36 people. You guys hold on. I'll be right back. I promise. All right. All right. Hold on one secaroni. Go live. See, didn't get the microphone correct. All right. Hold on. Here we go. Live. IC and pelvic pain support group meeting number 125. Holy crap. Okay, how are you today? Hold on, I'm just giving my description. Sorry, YouTube. Okay, come on, stop it with all these pop-up windows. Oh my God. How are you today? How's flaring? Struggling? Treatment? Diet? Not sure what to do next. We are here to help. Join us for the National IC Support Group meeting. All right, let's get this started here. Okay, now we're back. Oh my God. Oh my God. All right, let's get this right. Hi, Barbara. How are you? You know, my jaw, my TMJ is so bad. Look at that. My jaw is pushing to the left. I have to do my exercises. Oh, the stress of life right now. All right, Facebook, how did we do? Are we live on Facebook? Yes, we are finally live on Facebook, and we are now live on YouTube. Hello, my friends. How are you today? My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. I am the National IC Support Group leader. This is what I do. I've done for 28 years, and today is the 125th live support group meeting we've done on the internet in the last 2 years. How crazy is that? So my purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody to be able to diminish you, to make you think that you're damaged goods, or that there's no therapy, or that there's no hope for you, because there is always hope. There is always hope. And you know why there's hope? Because now we know why some of you respond to bladder therapies. You don't respond to bladder therapies because your problem merely isn't with your bladder. Your bladder is a secondary victim of something else happening, and so if you're not responding to therapy, if you're getting worse rather than better, if your pain is not improving, if your bladder is completely normal, when they look at you, I was working with a patient on Friday, bladder completely normal, and it was so interesting. So I always say you guys are an anatomical mystery to be solved. We cannot talk about treatments until we talk about your anatomy, right? We have to understand what is wrong with you physically before we can talk about what the right treatment could be for you, right? And remember, I'm not a doctor. I can't give you medical advice. My job is to educate, empower, and open doors. I want you to be able to walk back into your doctor's office knowledgeable that you can direct your medical care, because you are the boss. They are not the boss. You are the boss, right? Okay. So working with very interesting, very sweet, nice lady on Friday. And let's see, how did it go? I think her symptoms started about 10 years ago. She was in her 40s when they started. She had a hysterectomy a few years before that. And of course, whenever somebody's symptoms begin after a certain age or after hysterectomy, one of the very, very first things we're going to look at is estrogen atrophy, right? And so I started talking to her about that. Now she was 15 years post hysterectomy now. She was, are you dry? And she goes, "No, I don't think so." And I said, well, has your doctor given you any estrogen? She's like, yes, absolutely. Okay, so you have a doctor who says you're dry. So we know that's going on. So have you used your estrogen? She goes, no, it burns. Everyone I tried, I do it for a day or two, it burns, I stop doing it. I can't take any more pain. And so I give her the whole spiel about how the bladder wall and the urethra wall relies on estrogen. Remember, your bladder is like your mouth. It's a hollow organ covered with a really thick coating of mucus. And the purpose of that mucus is to protect the tissue, right? It's a barrier. It's a big, thick barrier. And so, it's very hard for irritants in your urine. It's very hard for bacteria to infect you when you have a nice thick coating of mucus there. And you know how dry mouth feels. Dry mouth is terrible. Well, dry bladder hurts. Dry urethra hurts too. And so anyway, I give her that whole big spiel, and it's like, honey, you didn't use your estrogen long enough. You've got to give it at like 2 weeks again to start using that estrogen to start producing mucus. She didn't know that, right? Okay. But here's where it got really, really interesting. So we started, the thing is that when they actually her bladder was healthy. She says, I don't get it. My bladder has always been healthy. Always, always, always. It's a baby bladder, just like mine. Mine is a baby bladder. There's nothing wrong with my bladder physically that you can see. I mean, structurally with the cells. So we walk her back in time because timing matters. And it's like, okay, take me back 15 years ago. What was going on back then? She goes, well, I had a baby when I was 40, and it was a 48-hour labor, and it was really bad. And I got really hurt from it. It's like, oh, okay. Well, that's important. So let's talk about your pain for a moment. Okay. So you said you had urethral pain. You said you had bladder pain. Do you have any other pain? And she said, yeah, I always have pain on my left side. I was like, okay. And then she said to me, you know what? The thing I really don't understand is why does it hurt when I sit down? Like I can't sit down anymore. Whenever I sit down, it hurts. I have to stand up. And that's when we start thinking about IC subtype 3 and IC subtype 4, pelvic floor dysfunction and or pudendal neuralgia. If you've got pain when you sit down that is relieved by standing up, that's not your bladder. It's either muscle or nerve. So we start kind of asking questions. And I like, well, hun, that's not your bladder. So have you had a pelvic floor assessment? And she said, no. And I said, well, I think we need to do that because we have to try to understand what's wrong at that location. Whenever you have a spot, whenever you have a specific location that the pain is always coming back to, we have to understand that location. It's like, okay, do you still have your ovaries? Yes. So, okay, so we want to maybe think, could it be your ovary? And then I said, but generally what we see is that I think, and I even asked her about sex, and sex was very painful for her. And so she had inklings of muscle tightness. She had inklings of muscle dysfunction. Sex was painful. She had pain when she was sitting down, and she had pain to the left of center, right? And I'm not wearing the right thing today, but like if your belly button is right here, her pain was like right here, right? So we started talking about that, and it was like, okay, well, how long has sex been painful? Oh, years. Okay, so that tells me that, gosh, I think you probably had some sort of maybe muscle injury from that childbirth. And she goes, yeah, I think I probably did. And then she goes, well, yeah, and I also have arthritis in my SI joint. And it's like, okay, okay. Now this has opened up a whole new can of worms here. So now we know, And then she said, "Yeah, I've been diagnosed with piriformis syndrome." And I go, "Well, do you know your piriformis muscles or your pelvic floor muscles?" She goes, "No." I went, "Yeah." All right. So she had 2 things going on. She had age-related drying in her urethra, which would explain her new urethral symptoms. But fundamentally below that, what she had was long-term chronic pelvic floor tension, resulting in tension in the piriformis muscle, resulting in squeezing of the pudendal nerve and or the sciatic nerve. And she also had pain shooting down her leg. And so in her case, what was so interesting is she kept saying, "Well, what do I do? Do I take Elmeron?" And I went, "No." I mean, Elmeron might be reasonable for estrogen atrophy, but we got to talk about the whole Elmeron retinal disease thing. But girls, you got SI dysfunction and you've got piriformis syndrome. The correct therapy for that is going to be pelvic floor physical therapy and consulting with an orthopedic surgeon to see what the hell's going on with your SI joint. And I mean, it was so mind blowing for her that kind of I wrapped these pieces together into her quote unquote IC. And she goes, "Well, can this all cause IC symptoms and bladder symptoms?" And I went, "Absolutely. Absolutely." And so she was kind of living proof for you and for me yet again that you are an anatomical mystery to be solved. We don't think of IC as an incurable bladder disease anymore. We think of it as a pelvic pain syndrome. Why? Because her case was a perfect example of why other structures and how other structures in the pelvis can be involved in your symptoms. And she goes, "Well, is it IC?" And I went, "Well, if we use subtyping, yeah, we would say your IC subtype 2 estrogen atrophy and your IC subtype 3 pelvic floor dysfunction. And your muscles are so freaking tight, they're squeezing nerves. So that brings you into IC subtype 4. And the correct therapy for 3 and 4 is going to be pelvic floor physical therapy, which she had never had. And it was just so fun kind of wrapping the pieces together for her. You guys, so I want to apologize. Last week, we kept having stream problems, and it actually was on my end. And I had Comcast out, and it was a problem with a wire. They say they have fixed it, and so Facebook, please, I want you to be vocal and tell me if you see any disruptions in the stream. I have 25 upload right now, which means I can be simulcasting in 4 places with no stream interruption. We're only doing it in 2, so we're good. We're on Facebook up here, YouTube down there. Hello, Nicole on YouTube. Nice to see you. Hi, Julianne. Hi, Debbie. Hi, David. Hi, Laquette. Laura, Sarah, Andrea, Catherine from Hawaii, the great state of Hawaii. Shelly, Pixie Dut. Oh, do you know if I could be any fantasy figure, I would want to be a pixie. you know, pixies are little tiny elves that fly all over, and in fantasy literature, pixies make the best assassins. According to Charlene Harris or one of the other authors there. Anyway, Pixie says, "Best thing that ever happened to me was the implant of the Medtronic InterStim device." Excellent. I'm glad that it helped you. InterStim is sacral neuromodulation. They can also do pudendal neuromodulation. Um, and it's a step 4 treatment option. It requires surgery. And according to the AUA guidelines, the American Urology Association guidelines, they don't want you to do surgery, easy stuff. So you start at step 1, you do everything in step 1, you go to step 2, you do everything in step 2, you go to step 3, do everything in step 3, and then you go to step 4, neuromodulation. InterStim has a checkered history. It is FDA approved for incontinence, frequency, urgency, overactive bladder. It can be life-changing if you're incontinent. It can absolutely change your life for the better, but it requires constant monitoring. You cannot have MRIs with older InterStim. I think there's a new one that you can. But it can also cause quite a few side effects. If you walk through a security screen, a malfunctioning device could shock you. It could turn it off. So InterStim requires lots and lots of monitoring. Ari says, "Diagnosed in my late 20s. Any other younger men or women? It's so hard to have a social or romantic life." Yeah, Yeah, I get it, hun. I get it, hun. But you got to remember, everybody has issues. They might not be talking about it, but everybody has issues going on. Nobody is in perfect health. There's always something going on. Like for me right now, I had a dental disaster with my front teeth. We're trying to replace them, and the crowns were mismanufactured this time. Fifth appointment. I still have temporaries right there. Um, yeah. All right, my knee's still numb from my damn compressed disc, so there you go. But we're not gonna bitch today, we're gonna be positive today. Lynn told, "No estrogen supplements due to endometriosis, which ended up with a hysterectomy." Thoughts? Well, you know, the challenge with endometriosis, obviously, is this uterine tissue that migrates into the belly, and as uterine tissue, it responds to changes in estrogen. The challenge with endometriosis is that as you have your period, wherever that endometrial tissue is, it will bleed. So if you have endometrial tissue up here, endometrial tissue is actually migrated up the chest. It will bleed, and open blood in your abdomen, it's very, very painful. So I can understand why they would want you to avoid estrogen supplements. Um, I guess the question is, number one, did they take your ovaries? I would assume that they did. And number two, it's kind of about aging. Um, Oral estrogen is distributed systemically throughout your entire body, but topical estrogen tends to stay in the skin. And so you may be able to use some topical estrogen if you've got dry vulva, dry urethra, dry vagina, but that's something you're going to have to talk to your doctor about. That's certainly challenging. Eve on Facebook says, "Do ovarian cysts affect the bladder?" Not directly, but when you have ovarian cysts, they're very, very painful. I know. I had polycystic ovarian syndrome myself in college. I threw dozens of ovarian cysts over a period of a couple of years. Um, and my sister had ovarian cysts too, which is interesting. When you have ovarian cysts, the biggest challenge is the pain. And when you've got pain, your nerves are getting amped up and your pelvic floor muscles are getting tight. And um, but there's also, and I don't, let's see, there's an interesting cascade of effects if you have a B12 deficiency. And that's kind of one of the being tested variants, subtypes of IC is a dysfunction in B12 processing, also known as porphyria, and perhaps a very small subset of patients that can lead to estrogen dominance, that can lead to ovarian cysts. And I am hoping that I'm going to be able to do a lot more articles on that, or a big intensive article on that this year. The science is very complex and very difficult. Laura says, "Antibiotics made me have more frequency with urination. What natural remedies besides aloe water can help?" Well, I get it depends on why are you taking the antibiotics? Are you taking the antibiotics because you think you have a bladder infection? Are you self-medicating with antibiotics because you think your flare is a UTI? Um, we have to understand what's driving your symptoms. So I kind of need a little bit more to go on, Laura, before I can even talk about that. Nicole says she would love an article on B12 and PCOS. Yeah, the science again complex. I've tried it once. Um, Catherine says you talk a lot about estrogen atrophy. Can you talk about those of us that have estrogen dominance? Catherine, um, I have to do more research on that. Um, I started doing research late last year. And we're starting to understand why estrogen dominance appears to happen in some patients. But until I get the science, I'm not going to really be able to talk about it in depth. Ashley says, "Can IC turn into bladder cancer over time if your bladder stays irritated and gets worse?" We've shown no connection between IC and carcinoma at all. The only context that we have, it really is with smoking. If you're a smoker, We know that all of those byproducts of you smoking end up in your urine, and then God forbid you hold your urine for long periods of time. You're then going to have carcinogens attacking your bladder wall all day, every day while you're smoking. And that is why cigarette smoking is not only linked to bladder cancer, it's the number one cause of bladder cancer. But here's the thing you might not know is that the children of smokers show they also show changes in their bladder and they struggle with frequency urgency. Basically, early IC because of the irritation of the smoke chemicals in the skin that they're breathing in, then it is being metabolized in their body. It ends up in their urine. And so the children of smokers will also have frequency urgency bladder irritation. Again, proven research. And so if you're smoking, if you got a smoker and you got children in your family, you better be smoking outside because you're damaging them. And I say that because my mom was a smoker, a big time smoker, and she smoked when she was pregnant with me. And you wash your hair in the morning and you walk out that smoking at the kitchen and you walk out of the room and you're just covered with smoke. Thankfully, she quit 40 years ago. But the damage that took on those of us who lived with that was, I think, we still don't quite understand it, but we know bladder irritation can happen. Pamela says, my physical therapist tells me I'm mental and you need to see a mental doctor. Well, hun, we all have our own issues and and trauma and fear and anxiety. And if your physical therapist believes that your fear and or your anxiety is impeding your progress, and usually they're a fairly neutral observer, um, why not give it a shot? Why not, why not have an opportunity to talk to somebody and just see if you can get some tips? I've been very vocal in saying that I struggled with massive anxiety when I was in my 20s and 30s, well, teenage years, 20s and 30s, until I took a class. And the class was the best thing I've ever done in my life. That class was so good. And, this week I was really traumatized by a really bad dental appointment, like really bad. They were trying to fit these teeth, do front teeth. They ended up reducing the size of these teeth. They left a sharp edge. It started cutting my tongue. They kept saying, they wanted me to just get used to it. And I'm like, no, this is wrong. They finally admitted, yes, the teeth were done completely incorrectly, but they were trying to get me to accept it. And I refused. And it's like, put the temps back on. These do not work. Period. End of story. Send them back. And after an hour, they admitted, yes, you're right. The teeth are malfunction. The teeth were flawed. And so, there are times when, and they even gave me they were hitting. Like my molars didn't hit. Only the two front teeth were hitting. Like after an hour of them working on it. And it's like, guys, nothing is touching. I have no sensation in any of my other teeth when I'm biting down, only my two front teeth. And they're like, well, if we make them thinner, they're going to break. And I'm like, and you'll have to pay for that. And I stood up. I said, I have paid you $6,000. You are going to fix these teeth. I refuse to accept that. Period. End of story. Don't mess with me that way. And I'm probably going to change dentist now. I was extremely unhappy with that and traumatized. I'm still a little traumatized. Dental trauma is hard. Debbie says, watching on Facebook, no issues. Awesome. Helen has had one freeze already. Crap. Margie says, what can I bathe in that is safe from causing an infection? Baking soda, hot water with a little bit of baking soda in it, a quarter cup of baking soda and a thing of water. That would be great. Tanya says, oh my God, Jill got on. Now you're talking about my pain. Pubic ligaments going down my inner thigh. Sent last week for a pelvic ultrasound, but I don't know what to do. Ice and heat to groin. I have weak IC issues. Girl, you're going to have to wait for that diagnostic workup. They've got to figure out what's going on. David also had one freeze. Crap. All right. Well, I'll be calling you guys. Count them up. For those of you watching on Facebook, would you Could you time them and count them up for me? Like, how often is it happening? And Becky says, "We're a bit fuzzy on YouTube, but it's not free." Ah, all right. Shelly says, "For any of you that wouldn't know really, Jill is the first person that I reached out to 14 long years ago. Jill she said, you saved my life. I was finally able to feel some sort of remission a couple years ago from the first time. No meds, life was better. Then all of a sudden I got shingles. Girl, I have never been the same. I'm just wrecked, this crazy pain." So the challenge with herpes, hun, is you get something called post-herpetic pain syndrome, where the nerves get kind of traumatized and amped up. Shelly, I'm so, so sorry. Normally, what they would do with that, you need to talk to your doctor, research something called post-herpetic pain syndrome. And generally, the therapy for that is going to be an antidepressant or Neuron to try to calm the nerves down. The same thing happened to my brother. He got the shingles vaccine, and 2 weeks later, he got a massive outbreak of shingles on his back and underneath his arm. And he's been using a little bit of Neurontin every day now for 3 to 4 years as it's calming down. But it is calming down slowly. Nerves do calm down, hun. Monica, I only have pain the day before my time of the month and a few days after my cycle ends, and sometimes during ovulation. Is there anything that can help with this? Well, Monica, there's always been a subset of patients, a very small subset of patients, but you're real because I've worked with many of you, where your symptoms are completely hormonally driven. And we know that as your estrogen gets low, your bladder wall gets more sensitive. And as your estrogen gets high, your bladder wall's in good shape. That's why birth control pills have now been associated kind of with the onset of kind of dryness, because birth control pills drop your estrogen levels. Your skin is meant to be moist. So we had a big case study released last year of an 18-year-old who had just started oral birth control. And within 2 weeks, she got all the symptoms of IC, all the symptoms of IC. And over a period of a year, it got worse and worse and worse and worse. And then bam, things got better. Hey, you know what? Let me do an experiment. I'm going to go tell them to turn off the TV and let's see if that stops any issues. Hold on. Give me a moment. Dad, can I do an experiment? My shopping is starting, so I'm going to turn off the TV and let's just see if that makes a difference. I do not understand why this is happening. All right, the TV is off. The TV is off. Let's experiment with that and see if that improves it. All right, so getting back to Monica, yes. For some of you, your symptoms are very hormonally driven, and in some of your cases, once we get it, where's my earring? What happened to my earring? Okay. Y'all know it's not a support group with me if something doesn't fall or something gets crazy. There you go. The only thing I can suggest would be maybe if you're having bladder wall pain, then I would be doing something with chondroitin in it that might give your bladder wall a little bit of an extra coating for those moments where your estrogen level's dropping. So that would be bladder builder, bladder rest, cystoman, cystoprotect, something like that, or maybe even allopath. Stephanie, having a flare today. I've had bladder installations for 6 years now. It's horrendous. Just wish that there was something to take it away. It can ruin it so much. Yeah, we're streaming.
Two computers.
Yeah, but all right. Here, hold on. Let me Let me turn this computer and put it on AT&T. All right. Okay, we're doing another experiment. All right, what was I saying? Okay, so getting back to Stephanie, I've had the bladder installations for 6 years now. It's horrendous. Just wish there was something to take it away. It can ruin so much. So, hun, number one, if you're not getting better on the therapy and you're getting worse, then the therapy is not working for you. And if you look at the AUA guidelines for IC, that's one of the things they're really trying to reinforce now is that 10 years, 20 years ago, patients were told you only had Elmeron and you only had DMSO, and that was it. And patients did them over and over and over and over again, even if they weren't getting better. And now the American Urology Association says that's not okay anymore. Your progress needs to be evaluated at every appointment. And if a therapy is not making you better, you should probably stop it and try something else. But Stephanie, what's important here is we have to figure out, you have to figure out with your doctors what the fundamental problem is anatomically. If you have Hunner's lesions, installations are a complete waste of time. They don't work. If you've got pelvic floor dysfunction, installations would do nothing for pelvic floor dysfunction. If you have pudendal neuralgia, installations will do nothing for that. All right. So this is a time to take a step back, talk to your doctor and say, listen, I've done this for 6 freaking years. My symptoms are horrendous. I'm not getting better. I want to take a step back and let's make sure we didn't miss something. Something is wrong that your therapy is not treating. And Stephanie, I would love to talk to you this week if you'd like to try to figure that out. Georgia says, which is better, Desert Harvest Aloe or Allopath? Well, aloe has a calming and soothing effect. Organic anthraquinone-free aloe. The reason why I like Allopath better is because it also has PEA in it for a pain-fighting effect. And so my choice is Allopath over the other aloes on the market. George also says, is Pura better alone or in Allopath? Well, Pure. Oh my God. What was that? And that's okay. If you've got IC subtype 5 central sensitization and your bladder wall's completely healthy and normal, then just doing the Pure alone, which would calm nerves down, makes more sense. Ashley says, is taking pre-leaf all the time bad for your body? Hell yeah, it is, because it's calcium. If you take too much pre-leaf, that calcium's got to go somewhere, and where it's going to go potentially is to your kidneys in the form of kidney stones. You only take pre-leaf before a meal and stay within the manufacturer's recommendations. Debbie says, I personally don't think anyone can understand this unless they live it, although it's hard. I don't quite understand what you wrote there. Sherry says, I left my husband of 23 years due to his smoking. My IC was a mess. So yes, smoking, even secondhand smoke. Yeah. Becky says, I was on birth control for 20 years. My estrogen levels are wrecked. I started estrogen cream in my early 30s. There you go. Pamela says, your pelvic floor physical therapist doesn't believe that interstitial cystitis is real. Well, I think it's how you define interstitial cystitis. It's frequency, urgency, pressure, pain in the absence of an obvious pathology in the bladder and or Hunner's lesions. So if that's what you're getting, I would talk to her boss or I mean, you got to ask yourself, number one, are there other physical therapists that you're able to work with at that clinic? Maybe you can just change clinics, but that's really completely disrespectful of you to tell you that IC isn't real when in fact our US government has spent easily more than $100 million, probably getting close to $150 million, $175 million studying IC and pelvic pain. IC is a pelvic pain disorder. Miriam said, has anybody tried keto typhon or tiffin? as a mast cell stabilizer? I don't know of anybody who has. Eileen says, has anyone changed their diet? What have you done? So Eileen, it all begins with your subtype. It begins with your subtype. Not everybody has to modify their diet. And let's just do this real quick. Let's just do this real quick. Okay. So when you actually meet patients, the diversity in the IC patient community is nothing short of astonishing. Because for some of you, it begins in childhood. For others, IC begins after menopause. You're both diagnosed with IC, but are you the same? No. For some of you, IC begins after starting chemotherapy. While for others, IC begins after having a baby or falling on your tailbone. You're both diagnosed with IC, but are you the same? Hell no, you're not the same. And when you actually look in the bladder, that's where you really see the diversity, because some of you have big bloody wounds in your bladders called Hunner's lesions. That's about 15%, 10% of you. The rest of us usually have normal bladders. So the bladders look quite fine. And the doctor does the cysto. He says, hey, your bladder looks good. You're laying there going, what the hell? I'm peeing all night. How can my bladder be the same? And there's an explanation for that. And so for about the last 10 years or so, internationally, among the top tier IC researchers, they have been racing to define the variants of IC, the subtypes of IC, because it's really crystal clear that a one treatment fits all approach doesn't work. Elmarin does not work for the vast majority of patients who try it. Why? Because a lot of us don't have fundamental bladder issues. Our bladder is a victim of something else that's happening in the pelvis. And so in Europe, there are 12 variants of IC that they use in their IC diagnostic workup. In Canada, they use a system called Input, where they look at muscles, they look at the presence of infection, they look at other neurological diseases, et cetera, et cetera. In the United States, we do not have a nationally agreed upon system, but I use a system that was created by Dr. Christopher Payne, who ran the IC research program at Stanford for about 25 years and chaired National Institutes of Health IC meetings. And he introduced his system 6 years ago, and it's, I believe, certainly revolutionized my work, now what I do when I coach patients. But he introduced it in a really provocative way, because he said we should be treating IC patients like cancer patients. And I'm like going, oh my God, don't say cancer and scare people. Why would you do that? But he says, no, if you're struggling with cancer, they don't just say you have cancer and send you on your way. They give you a really specific diagnosis. You have cancer of the left breast that is estrogen dependent type 1, 2, 3. Or in my case, a few years ago, complex endometrial hyperplasia with atypia and a vague architectural complex. Early uterine cancer. And the diagnosis is so specific that both you and the doctor know what your treatment options are. And for me, it was hysterectomy, right? And he says a diagnosis of IC is fairly meaningless because neither you nor your doctor have an intuitive treatment plan. You walking out that office, they give you maybe a brochure, they tell you about the diet, maybe hand you a prescription for something, and they say come back in 3 months. And you're going, what the hell? Wait, what? You want me to come back in 3 months? I'm up all night crying. How am I going to get through the night? So he says that the way you create an intuitive treatment pathway that works for you is with a more individualized diagnosis, subtyping or phenotyping. And in his system, there are 5 core variants, but in each variant, there can be some subvariants. So let's go through them really quickly. Okay, so subtype number 1, Hunner's lesions. Seriously, if you got big bloody wounds in your bladder and you can't eat more than 4 or 5 foods and you're crying in pain and you're peeing blood, you got something seriously wrong. You got a big bloody wound in your bladder. You got a Hunner's lesions. And Hunner's lesions are the one thing everybody agrees on, that it's pretty much its own separate disease. When you biopsy a Hunner's lesion right in the center, there's massive inflammation. The rest of us have no inflammation. Only Hunner's lesion patients have really bad inflammation in their bladder wall. And the bladder wall is starting to break down. Um, when you have inflammation, that means that there's a war happening. Your tissues are fighting something in that war. And now we have a clue as to what that can be. Because researchers in Europe 5 years ago, 6 years ago, were the first to discover that Hunner's lesion patients appear to have active virus in their urine, something called the polyoma virus and the Epstein-Barr virus. If you had mononucleosis, Epstein-Barr, guess what? Your bladder can be infected with viral infections. And of course, we were just Julianne, thank you so much for sending us stars. I really appreciate that. Thank you. So here's the deal. When you think of bladder infection, you're thinking bacteria. You're wrong. You're wrong. You can have a viral infection in your bladder and you can have a fungal infection in your bladder. And we'll talk about that in a little bit. So anyway, we had several studies that found virus in the urine of patients with Hunner's lesions, but no virus in patients who didn't have lesions. Okay, so that was meaningful. The second thing is we know that in patients who are immune compromised, like somebody going through kidney transplant, they're on anti-rejection drugs, the viruses kind of get turned on and they infect the bladder wall, resulting in something called hemorrhagic cystitis. So we already have research that has clearly linked hemorrhagic cystitis to viral infection in a population of patients. And we were waiting and waiting and waiting for years for the US government and our own National Institutes of Health to comment on this. Well, what I didn't know is that they were doing their own study and they released that data last year. And what do you think they found? Active virus in about 10% of patients. So this is exciting. This is very exciting. I mean, number one, now we know why Hunner's lesion patients can be very difficult to treat. Now we know why Elmeron wouldn't work for them, why bladder installations wouldn't work for them. And now we know why injecting a steroid would be helpful to them because it would reduce inflammation. We know why cauterizing would help because that basically destroys the nerve that the virus is potentially living on in those patients. And we're doing now something called next generation urine testing, which can identify viruses in it's a specific test they have to do, but it's opening up a whole new line of therapy, which could be antiviral therapy. Also understand too, in our COVID and IC research, we have 14 research studies that have found active COVID virus in urine. We have studies that have found active viral infections in the kidneys, COVID. And so in our research studies, 75% of IC patients who get COVID report that their symptoms got worse. 25% their symptoms became very severe. And for some patients, it brought them out of remission. And the hunch is that it's because the COVID is infecting their bladder wall. And that can take several months to resolve as the virus does that. Okay, so anyway, getting back to this. Okay, so guys, seriously, yet another reason to wear a freaking mask. Protect your freaking bladder here. Okay, you already know what bladder pain is like. Imagine having an active viral infection in your bladder. Yikes. Double mask, please. So for this subtype, what we want to do is use lesion-specific therapies, cauterization, steroid injection, hyperbaric oxygen therapy, et cetera, et cetera. And you can read all about that right on our website, icnetwork.org. Slajana asked about vaccination and ICR vaccines to prevent COVID-19 safe and advisable. Well, millions of patients have already had the vaccine. And a handful of IC patients are reporting flares. I've had 2 people email directly with what they felt were vaccine-driven flares. But quite a few in these meetings report that they've had the vaccine and they've been fine. And when you compare the pros and cons of the risks of the vaccine as compared to the risks of an active COVID infection, that's another story. Lori, would you please do me a favor and hold on to that question about chair cushions? Let me finish the subtyping. IC subtype 2 bladder. So these are the patients who legitimately have a real bladder wall going on. Okay. Nobody doubts that. Oh, so we have 3, maybe 4 variants in this group. Variant number 1 is chemical injury. These are the patients whose symptoms began after chemotherapy, or their symptoms began because they didn't drink water, they only drink soda or coffee or diet soda, stuff like that, artificial sugar. Generally, the bladder is injured with a chemical exposure of some type. So that's the first thing that we see. The second variant in this group of bladder wall driven is going to be estrogen changes in estrogen and dryness, estrogen atrophy. So if your symptoms began after the onset of menopause, perimenopause, menopause, postmenopause, or you started birth control, or you had a surgical hysterectomy, you know, or you've started taking Lupron for endo, again, when I started this meeting, you have to understand that the bladder needs estrogen to produce that nice thick coating of mucus. You've got to learn about what we call the genitourinary syndrome of menopause. And it is in this case that a therapy like Elmeron makes sense, because Elmeron is a protective coating. It's a Band-Aid. And if you don't have a good coating yourself because you're dry, using something that has a protective coating makes sense. But again, we're really not using Elmeron anymore. We're going for instead either heparin installations, maybe Elmeron installations, but not Elmeron orally so much because of the retinal disease, or the chondroitin-based supplements. The third variant in this group is going to be chronic fungal infections and black mold exposure. So again, it was our own National Institutes of Health who discovered in their urine studies that many patients who were flaring because they had active fungal infection, candida infection in their urine. And that's another one of the great tragedies here, because you are dying in pain. You are sure you have an infection. You do a home UTI test, it is negative. You go to the doctor, they do a urine culture, it is negative. But the problem is they're not testing for fungus. And that's again why next generation urine testing is so good. If you flare when you eat sugar, if you flare when you eat carbs, you probably have active candida systemically and or in your urinary tract as well as your bowel. And take it from somebody who's had one. I had one for 2 years that I got from doing a long-term antibiotic protocol years ago, which is what we used to do for IC. And I had drug-resistant Candida glabrata. Took 2 years to kill. And holy hell, was that so much. That was the worst pain I'd ever had in my bladder, was from a fungal infection. So now we do next generation urine testing to find that out. Then the last kind of mini variant in this group is going to be the patients who are, again, kind of younger patients who are clearly showing some sort of hormonal dysfunction, but that hasn't been fleshed out. There's still a lot that's going on. We also have to consider in this group structures outside of the bladder that can be pushing on the bladder, like a fibroid tumor or endometriosis that's attached to the bladder wall or burrowing it into the bladder wall, or even Tarlov cysts or pelvic congestion syndrome, right? Those are things that can victimize the bladder and trigger some of those symptoms. But that's actually a small subtype. The bigger subtype is this subtype, pelvic floor driven. Why do I say that? Why do I say that? Well, number one, we've got the research that proves that pelvic floor physical therapy outperforms bladder therapy in the vast majority of patients. And that research was released in 2008. That's when the IC world at that point in time had to stop and say, uh-oh, maybe IC isn't really a bladder disease for some people. Maybe there's a muscle issue going on. But when you spend time with patients, that's what you see. For many of you, your symptoms began after you fell, or a history of athletics. If you were a football player, if you were a paratrooper, if you were a ballet dancer, if you were a gymnast, if you were an ice skater, if you have any sort of repetitive trauma to your pelvis, that can affect your pelvic floor muscles. And through something called a viscerosomatic reflex, if you suffer a somatovisceral reflex, if you suffer a pelvic floor injury, that muscles become weak, they become tight, they start restricting blood flow to the bladder and other organs, they start damaging the nerves, and there you go. Then you start getting bladder symptoms. So if your symptoms began after some sort of physical trauma, we have to look at the pelvic floor. That is why every doctor at your very first appointment should be doing a pelvic floor assessment. The AUA says that should be done, and they said that in 2011. And it's shocking the number of people who've never had a pelvic floor assessment. Linda says, does a flare up with blood in your urine always mean you have Hunner's lesions? If you got lots of blood in your urine, I would want somebody to look in your bladder to see what's bleeding. You could have lesions, but you could be bleeding from your kidneys, or you could have infection. Cassandra says, can you be more than one subtype? Yes, you have estrogen atrophy and pelvic floor dysfunction. That's because everything's connected. If your bladder's screaming in pain, your muscles are going to get tight. We can get your bladder to stop screaming, but if we don't get those muscles corrected, you're still going to have muscle issues. All right. So pelvic floor driven. So one of the questions I ask patients is, when is your pain the worst? Before you pee or after you're done peeing? If your pain is worse before you pee, that's your bladder wall. If your pain is worse after you're done peeing, that's your pelvic floor usually. Okay. But also it's about where your pain is located. You know, let me get my model here. Oh, my leg is really bad today. I'm so frustrated. I ruptured two discs in my back and it's really affecting my right leg. Life, right? Right. All right. So let's look at this for a moment. Let me put my model here. So look, here's your pelvic cavity, right? And you have to understand that the pelvis is the center of the human body. It carries the weight of the torso through your hip bones, but it also deflects all the stresses from when you're walking and running. The muscles in your pelvis will help you open your legs to the side, right? They're intricately involved in how you move. And the challenge here is that the pelvis is a very small cavity that has a lot of stuff going on. Number one, there are a lot of structures in the pelvis. So here we can see the muscles. Whoops, hold on. And you can see that the pelvic floor muscles, my levators are not staying on. Come on, levators, get on there. All right. You can see that the muscles are basically flat along the bone, right? They're flat along the bone. And a tight muscle will bunch up. It won't be flat. It will lift off of the bone and it will be very congested. Now let's put some structures in here for a woman. And man, I'm sorry, I don't have a male in pelvis, and I need to get one. So we're going to put the vagina and the ovaries in here. Bam. We're going to put the bladder in here. Bam. Right. And now you can see, so here's your pubic bone right here. And now you can see why you have pain just above your pubic bone that's centered, because that's your bladder right there. Whoops, right there. Okay. Then we got to stick the bowel in here. And you, hold on. It's amazing, right? All right. So now we got the bowel in here. So look at how congested this is. You also have blood vessels going through here. You also have nerves going through here. And where Western medicine fails is they don't understand the influence of how these work together. We know, for example, the nerves of the bladder and the nerves of the bowel merge right here in the sacrum. They become shared nerves. So we have something called neurocrosstalk. We know that if the bladder gets irritated, the bowel will probably show signs of irritation. If the bowel gets irritated, the bladder should show signs of irritation. We called that the pepperoni pizza algorithm years ago. So we know the nerves are proximal. We know the nerves are linked. But where they all kind of fail to specialists is they stay in their sandbox. So urologists stay in the urinary tract, gynecologists stay in the reproductive system, gastroenterologists stay in the bowel, and they don't necessarily look at how these babies, the muscles, can be playing a role in their symptoms. And I want you to consider for a moment the levator muscles. So you've got 3 layers of muscles. So where each knuckle is a layer of muscles. So you've got shallow muscles, which are the levators right here. So if you're a bike rider and you sit on a sit on a bicycle for a long period of time, there's no bones protecting these tissue. The bike seat is pushing right up into these muscles and into these nerves, aka bike rider syndrome, right? Then we have to consider the mid-level muscles, and the mid-level muscles are going to be, you know, right in this area, right? I'm sorry, it's hard to hold this up and demo it properly. And then we have to consider the deep muscles, piriformis muscles, obturator muscles right up here, right? Any one of these muscles can be messed up. Piriformis syndrome. If you've got piriformis syndrome like I do on my left side, and again, so like right up here, the muscles are tight right up here. Why? Because, at least for me, these muscles hold the SI joint together, and my SI joint moves too much. And so those muscles are always trying to hold my SI joint together. And we won't even talk about the bulging disc here and here, which I now have. Ugh. Oh, no, thank you. No, thank you. But thank you for asking. So the correct therapy for pelvic floor driven patients is physical therapy. Now, there's a fabulous book. There's a fabulous book you must get. And guess what? It's free, no excuses, on Kindle Unlimited. This book. This is the master class in pelvic injury. This is the master class in muscles. This is the master class in bones. Dr. Jerome Weiss is a famous pelvic pain specialist in San Francisco for years. And he saw early on as a urologist that bladder therapies didn't work. And so he dedicated his career to muscles and nerves and all that other stuff. And he became a master at working with patients with pelvic pain. And one of the things that baffled him was why, you could go see him and he would get rid of the trigger points in your muscles. He would get rid of the tension, but 2 weeks later, it'd be back in exactly the same spot. Why? Why does that happen? And the answer comes back to bony structures, that if you have muscles that are chronically tight, there can be a reason why. They may be compensating for a bony abnormality and problem with your bones. Like for me with my SI joint, your hips, your knees, your feet. So please get this book. It's so freaking good. If your symptoms began after trauma, if you experienced some sort of trauma, if you were hit by a car, if you were in a car accident, if you were torn when you had your baby, anything at all like that, this book will help you understand why that could be affecting your bladder. Okay. David says, turn YouTube off. You know what I'm probably going to have to do is just split y'all. I'm getting another camera right now, David, for my other computer, and I will have the camera on this computer so that I will be looking in, but I will stream YouTube on another service. Or we can just go to Twitch and y'all can come over on Twitch, which would probably be the best thing to do. But anyway, I've been threatening to do that for 2 years now. I see subtype 4. So, again, listen, if you've done bladder therapies and they're not working, if your bladder wall appears normal, stop looking at your bladder. It's time to have a pelvic floor assessment, and let's make sure you don't have something wrong with your pelvic floor. I see subtype 4 is pudendal neuralgia. These are the patients who have symptoms when they move. Like they sleep fine, but as soon as they sit on the side of the bed, bam, it hurts. They're fine when they stand, but when they sit down, it hurts. Or there's a needle sensation on their vulva or down their leg, the inside of their legs. Or you might have persistent genital arousal disorder where you feel like slightly aroused, but it's really disgusting and painful. And that just means that the pudendal nerve is being irritated and or compressed by tight muscles. So our therapy for this group of people is to try to figure out where and which nerve is compressed, where it's compressed, and calm that nerve down and also deal with the compression, aka usually tight muscles, right? And then the last subtype is central sensitization, chronic overlapping pain conditions. And this is also my subtype. So these are the patients who have IC, IBS, vulvodynia, TMJ. And you can always see when my TMJ is weird because my jaw is not centered, right? As it wasn't this morning. Why does that happen? Why are there some patients who it starts in childhood and it's like every other year they get a new pain condition? And so for me, I had frequency urgency in 7th and 8th grade. I had vulvodynia in high school. I threw ovarian cysts in college. I got IBS in my first federal job. I had migraines in my 20s and then quote unquote IC in my 30s. What the hell is that all about? And you feel crazy. It's like, what is going to happen next? And we now know that that actually is a central nervous system injury, for lack of a better term. We call it a maladaptation. And what brain studies have shown is that in patients with chronic overlapping pain conditions, as well as in patients with IC who have other pain conditions, our brains are functioning differently. We are living with a brain that is stuck in fight or flight. We have extremely high levels of anxiety. So I participated in the International Pelvic Pain Society meeting last October, and it was dedicated to this, and it was so wonderful. And there's a happy ending here. But what it showed is that um, the two dominant risk factors are physical trauma. And 80% of the people, and especially the children that this began in, the year before it began, they had some sort of major physical trauma, broken leg, broken arm, car accident, hit by a car, something like that, that damaged their nervous system to a certain degree. But we also know that abuse and bullying can also make this happen. So here we've got a brain that is stuck in fight or flight. The amygdala in the brain is staying on. So let me give you a little lesson here. You got two fundamental nervous systems. You've got the sympathetic nervous system and the parasympathetic nervous system. And remember the purpose of your brain. Your brain's sole job is to keep you alive. You know, it is at every minute of any given day, it is listening to everything. It is trying to save your life. So if it smells smoke, it's going to go, uh-oh, there might be a fire somewhere, right? So underneath that, the sympathetic nervous system is a nervous system that gets turned on if you were, for example, to open your front door and see a saber-tooth tiger. Like you open your front door, you're ready to go to work, and there's something threatening across the street, your sympathetic nervous system is going to take over because it's going to try to save your life, and it's preparing your body to fight or flee. So how does it do that? It raises your blood pressure, it raises your heart rate, and it tightens your muscles, and it changes blood sugars. And you step back and you slowly shut your door and you're like praying that the saber-tooth tiger doesn't see you, and you're looking out the window and it goes on its way, and whew, you breathe. When the threat is gone, the parasympathetic nervous system takes over. And what that does is calm everything down. It reduces your heart rate, it reduces your blood pressure, it reduces everything. So, normally, the sympathetic nervous system is on for very limited periods of time. You live daily with your parasympathetic nervous system that's keeping everything calm. But for those of us with chronic overlapping pain conditions, we're stuck in stress. We're stuck in fight or flight. The amygdala is turned on. The sympathetic nervous system is still on all the time. So we have to turn it off. And the way we turn it off is with mind body medicine. And I have a big article on that in our latest magazine of the IC Optimist. It's very exciting. Okay. So if you don't get our magazine, the IC Optimist, you should. Um, uh, I think the most important article I've ever written in 25 years is this article, Chronic Overlapping Pain Conditions, Multiple Pain Conditions Now Explained. And I didn't talk about it years ago because I didn't understand the brain studies well. And I didn't want to scare you. And frankly, I didn't want to scare me. And since I'm in that group, but now we clearly understand it. We clearly get it. It is a maladaptive process. Our brain gets stuck in fight or flight. So we're going to turn it off, and we can turn it off, and we can retrain that nervous system with some very simple mind body medicine techniques like I Spy and tapping. And we might do that in a little bit, but I don't want to do that now. So, anyway, those are your 5 core subtypes. Hey, somebody asked about chair cushions. Hold on a sec. Let me get them. Where is my waffle? Oh, I know where it is. My dad's sick. If you have pudendal neuralgia, you have sensitivity when you sit down, you're going to want a cushion like this, right? So you'll see it has a groove down the middle. So each butt cheek is supported, but nothing is pushing up against your crotch. And so these are CAPS cushions. We used to sell blue chair cushions too. They were discontinued due to COVID, so I don't have those anymore. But this is the travel cushion, which is very cool because look at how, I mean, it's so easy to carry. Actually, you do it like this, right? Cool. Fabric's awesome. And they're in the $60 to $70 range. Our other cushions were cheaper, but again, we can't get those anymore. We also have a waffle cushion, which has kind of holes in the middle of it for people who have to sit for long periods of time. And that's great for if you have pain when in your glutes when you're sitting, right? So those are the key chair cushions, and you can find those in our store on our website. Now, y'all understand that Facebook scrolls by very, very quickly. And if I have missed your question, please ask it again. Be the squeaky wheel. I won't take it personally. Please do not take it personally if I miss your comment. Diana says, I asked my gynecologist for a prescription of estrogen vaginal cream for my estrogen atrophy. I'm a little bit concerned about the cancer risk. Many times you recommend you put a little on the opening of the urethra, and that will help with urethral burning. That's okay. So, Diana, I want you to Google topical estrogen safety, and you look at the research studies. The research studies show that when you use estrogen cream topically, the estrogen does not travel to any great degree throughout the rest of the body. It is considered remarkably safe. And we have new studies every year about the safety of topical estrogen. But don't believe me, you read it, and then I want you to talk to your doctor about what your worries are. Okay. Now, and generally for women who have urethral discomfort, they will usually have you rub a little bit of estrogen cream at the entrance to your urethra to give that tissue a jump start and give it some cream. Give it some estrogen also. All right. Mallory says, past history, 2 to 3 UTIs a year, October 2020. A UTI was not treated quickly, not by choice, went to a kidney infection. Afterwards, I've had horrible pelvic pain. First, I was diagnosed with hypertonic pelvic floor. That helps. But recently, I've been having a fire feeling in my bladder. You started your IC diet and you feel much better. So, the bladder is the slowest healing organ in the body, number one. You got to understand that when you have a real infection in your bladder, which is all possible, I've had 2 in the last 25 years myself, cells are damaged. And bacteria kind of, hold on. Where is my handy dandy slide? All right. All right. So look, this is a side view of your bladder wall. So the top layer, which is blue, and of course it's not really blue in your body, is your mucosal barrier. Underneath your mucosal barrier, you've got your urothelium, which is 4 to 5 layers of urothelial cells. These are the largest single cells in the human body. If you look at them under an electron microscope, it looks like a beehive. They're hexagons. and they have something called tight junctions. They fit really tight together so nothing can pass through them. So imagine an extra large pizza, and then imagine a little tiny green pea under that pizza. Um, the pizza is the umbrella cell, the pea is the stem cell. It takes 2 weeks for that stem cell to rise and fill in that hole. So when you get real infection, what happens is the infection might hit this cell, and then it might go to this cell, and it might go to this cell, and it might go to this cell, and it might go this way. Then you might have another infection over here. You get tunnels, you get burrows in your bladder wall. And it takes time for those to heal. It does. This is where next generation urine testing really shines, because it will not only identify the potential bacteria, but it will also identify drug resistance genes and will give you better recommendations on what the correct antibiotic to use for your specific infection. So, concept number one, Mallory, is did they get it all? And if you're still having similar symptoms, you are a perfect candidate for next generation urine testing. It would be fascinating to see what's going on in your urine, especially if you took a lot of antibiotics, because you may now have a secondary fungal infection, candida infection, which could explain your symptoms. The second thing that we want to look at is, hypertonic pelvic floor muscles make sense, because when your bladder's screaming from an infection, your muscles are going to get tight to protect you. The question now is that you have a burning sensation in your bladder, and estrogen atrophy is real, but I still have to go back to the fact that we're guessing. Everybody's guessing, and there comes a time when you need facts. And a next generation urine test would give you facts. Jeannie says, is today the 28th? Yes, this is our 125th live support group meeting. Thank you for the stars, Julianne. Nystatin for the glabrata infection. Yes, nystatin is what finally killed the infection that I had. Georgia says, Allopath and Desert Harvest has calcium already. Do you think the pre-leaf is okay to use 3 times a day? You don't need to use pre-leaf if you're not eating an acidic food, hon. So only use it when you're eating a risk food. Eileen says, it's been 2 months since my last treatment. You're having a flare today, so it worked for a while. Interesting. Peggy says, have you or anyone done Botox injected into the bladder? Lots of people have done Botox injected into the bladder. It is a step 4 treatment option. You have to understand with Botox that there is a risk that you could develop urinary retention. When they do Botox, they just inject different portions of the bladder wall with the hope that they're silencing the nerve that's giving you frequency, but they could actually silence the nerve that allows you to pee. And so Botox is not supposed to be done in people who are unable to self-catheterize. It comes with risks, significant risks. So you really don't understand that if you're not comfortable self-catheterizing, then you probably should not do Botox. And that's what the FDA says about that. Gina says, what are the treatments for pudendal nerves? Doing physical therapy with a great physical therapist, but it's still zinging me. You have PGAD. Well, they might need to do a nerve block to just silence that nerve and to let that nerve rest, right? Because nerves kind of get upregulated. When they stay on, the pain, they just amp up and they amp up and they amp up and they amp up. And so giving that nerve a period of rest is helpful. And that's why nerve block might be helpful. But they might also want you to do something called Neurontin or even amitriptyline, which can calm nerves down. All right. Mallory says, okay, I thought it was UTI, but after testing, it was a fungal infection. Does a yeast infection affect the urethra burning? Hell yeah, girl. Yeast is agony in the bladder. Thanks to you, I found Dr. Peters in Royal Oak, Michigan last summer, who did surgery and removed the lesions from my bladder. I was diagnosed with these lesions in 2016. The doctor did not do any type of surgery, but instead sent me down the rabbit hole of medicine to no relief. I also saw Urogyne. She too sent me down the path of installations and drugs. Both dismissed me and never talked about treating the lesions. I recently had sex with my partner for the first time in 6 years. Well, girl, you're getting there. It was painful. That makes sense after 6 years of lesions, because I'm sure your muscles are very, very tight. But girl, you're making progress. You're in good hands with Ken Peters, one of the top doctors in the world. And eBay is asking about Desert Harvest. Lots of people have used Desert Harvest. We got 2 primary aloe options, Desert Harvest and Allopath. Anne says, "Do you use estrates after hysterectomy?" Yeah, that's when you really would want to potentially use it, because that's when your estrogen levels really drop. Marcella says, "Thanks for mentioning nystatin. My doc gave it to me and it helped. Finally, I went to a urologist at Johns Hopkins. He told me to do, damn it, it moved, physical therapy." Okay, you guys, you're talking like mad over here on Facebook. It is scrolling through here fast. Hysterectomy. Okay, so you're saying, Leanne, hysterectomy can make IC worse. You need to be more specific than that. Hysterectomy can make muscles tight, but pelvic floor physical therapy can fix that. I know. I went through it. Valerie says last June she cut out all drink citrus. You took the opportunity, lost 39 pounds, and your flare-ups are reduced to maybe once a month, but they are also much less severe. I've been eating lots of bananas, but just cut those out too. See if that will help. So that points to your bladder wall as being your fundamental issue, hun. If diet's helping you to that degree. Pam said it froze again. Elmeron took over 20 months. Never worked for me. Right. D, if Elmeron didn't work for you, if DMSO didn't work for you, it all goes back to your subtype and finding the right therapy for you. Pamela froze 23 minutes ago. Let me go make sure they didn't turn the TV on. Hold on. Tanya from Belgium. Hold on. I have had fibro for 8 years, abdominal pain for 4 years. I have 8 bladder rinses, D-Manos, aloe vera, yet I continue to have pain, especially at night. Panty liner looks yellow and smells like ammonia, but negative for bacteria. Could it be a fungus? Well, we would want to potentially rule that out. But, hun, you also have to absolutely get our magazine. And if you email me, icnetwork@mac.com, I will send you our magazine for free. I want you to understand that the fibromyalgia creates the foundation for some chronic overlapping pain. Okay, let me go check and make sure they didn't turn the TV on. Hold on. Debbie's now saying you've been freezing a bunch. Damn it. Okay, Comcast will be getting a phone call tomorrow. Hold on, be right back. Morning, Mom. I'm working. Yep. Somebody turn the Oh, the joys in working from home. So the TV has now been turned off. Let's see what happens. David says, what is Twitch? Twitch is a streaming service, twitch.com, that streams a lot of games, but also a lot of lectures and stuff like that. I watch it every day. I love Twitch. I barely watch the TV. I usually just watch Twitch. Nan says, I signed up and paid for the subscription a number of months ago, but you haven't received a magazine yet. So, Nan, our magazine went out over New Year's. So you should have gotten something over New Year's. And so, hold on a sec. Let me just, I can just tell you right here. Give me a quick moment. Let me see if I can find you in our system, because sometimes people confuse us with the ICA and they send their money to the ICA and they don't get our magazine, and that makes them unhappy. There are 2 different national IC groups, guys, the ICA and the IC network. Hon, there's no subscription attached to your account. So call me, pop me an email, Nan, IC Network. I don't see a subscription attached to your name. So was it done under another name? We would look. All right, but Nan, we'll work it out. I'll work it out with you. We'll figure it out, okay? But on Tuesday, tomorrow's my day off, so we'll do it on Tuesday. Let me look at under one other thing real quick. Hold on. I know you don't have a subscription on your account on your name in our store. Yeah. Okay. Well, we'll figure it out. Eve says, any studies about the low oxalate diet? And I see no, but low oxalate diet, foods that are high in oxalates like spinach, chocolate, berries, can be irritating to some patients. So it makes sense to reduce those. Somebody is offering spiritual readings, guys. You're not allowed to advertise here, so please stop it. Guys, they're not authorized by me, and I need to stop this person from advertising right now. Uh-oh, okay. Reported. Look at this, seriously, Olani, whoever the hell you are, get out of our meeting. Get out of our meeting. You're not an IC patient. There's no reason for you to be in here. Please leave. Oh my God. Does Lula Girl continue to be improved from the Lyris? I don't know. Sorry, guys. I'm dealing with an intruder here. Did it stop freezing? Yeah, it must be. It just must be the TV. Does the magazine come in the mail or electronic? It depends upon your subscription. If you have the $25 subscription, it's in your member page. You can go read it right now. If you have the $50 subscription, it's mailed to you, but you still have a member page where you can read it. Hold on a second. Olani, please get the hell out of our meeting. You do not belong here. All right, guys, hold on a sec. It's gonna make me bring out the big guns. Thankfully, this doesn't happen very often, but give me a moment. That should hopefully take care of it. All right. All righty. Does hydroxyzine cause weight gain? And the answer is it can a little bit. Yeah. Jessica says, do we sign in to see our member page? Yes, you do. You have to sign into your member page in our store. Sean says, saw my podiatrist Friday. He recommended arch support to help alleviate some of your pelvic pain. Good to know. Awesome. So Jonna says, I'm trying to make a choice between Sister Q and Bladder Q. Do you have any advice, please, as to which one? Neither, not because they don't contain chondroitin. And it's the chondroitin that helps to protect the bladder wall driven, bladder rest, Cysto Protect, or Cystomed. But one of those contain the most important ingredient. Those were supplements from 20 years ago. We don't really use those anymore. We haven't sold Cysto Q in a decade, I think. Ursula says, I get burning from a treadmill incline workout, also sitting in a reclining position with legs up higher than the pelvis, also react to certain plastic irritants. So Ursula, if your pain happens in certain positions, we're always going to look at muscles and nerves and understand that if that is long-term, that is going to be affecting your bladder wall also through a somatovisceral reflex, which I have explained multiple times. Muscles can affect organ behavior. That's the somatovisceral reflex, and organs can change muscle behavior, which is the viscerosomatic reflex. Angie said, I've had a UTI for 6 weeks, 3 different meds with no availability. Should I request next generation testing? Yes. Yeah, you should. I mean, that's going to tell once and for all what it is, and more importantly, it will identify drug resistance genes. It may be that you've got a super drug resistant infection that needs to be checked out, right? All righty. Okay, so it's now 2 o'clock California time. This is normally when we start the Zoom portion of the meeting, and that is where you can come into the Zoom meeting and ask your questions. I'm going to leave Facebook open. I'm going to leave YouTube open so you guys can hear this, okay? So let me go ahead and start the meeting on Zoom, and then I will give you the links if you want to come in and talk to me. And if you don't, that's fine. If you don't want to do it this week, I got no sweat. That's no problem with that. So here, hold on a second. So the way you can go into our Zoom meeting is network.org. Page of our blue website, you're going to click on support right under the logo. The second link, streamed support group meetings. There's my face with curly hair. And you're going to click on the Zoom link. And that's exactly how I am launching this meeting. All right. The meeting is now officially open. And let me get your invite. All right, so YouTube, here's your invitation. If you want to come into Zoom, I will let you in one at a time. Facebook. All right, Facebook. Did you get that? I don't know. Did you get that? There you go. There's your invitation to come into the Zoom. I will let you in one at a time. And please understand that this is where people will hear you. Give me one quick sec. I will be right back. And let's see here. All right, so Facebook, let me give you this invite one more time if you want to come in. And YouTube, let me give you this invite one more time. Man, today is just flying by. That I also kind of wanted to show you guys, but let's go ahead and jump right into Zoom. So we're going to do Zoom for a little bit, and then we'll come back to Facebook, come back to YouTube, and take more questions. All right. All right. So let's go to Julianne. No, not Julianne. I'm sorry, Julianne. You hold on. Ray. I want to go with Ray because she was the very first person into the meeting. Hello, Ray. How are you today? Okay, I can't hear you. Okay, we need to unmute you. You are muted. Can you unmute yourself? There you go. Hey, girl, how are you?
Good. My name's Eileen. It's under my husband.
Oh,
Ray.
Hi, Ray. Hi, Eileen.
Hi. If you can help my wife, I'd appreciate it. She's had IC for a very long time, and she struggles really seriously with it.
I absolutely want to help her. So
Since 2002, you know, the urgency, the pain, just everything.
Okay,
but
so
I'm just starting therapy, pelvic floor therapy.
Okay.
I just started last week.
Okay.
But now that I have a new disease, lichen sclerosis.
Lichen sclerosis. Okay.
Yes. Do you know what it is?
That's
I didn't
just.
really.
Did they give you clobetasol to put on your skin down there?
Yes, I just got the tube for that. I have to do it twice a day.
Good.
Well, what exactly is it? I mean, I don't even know what I'm looking for. I don't
Well,
know what it is.
The name lichen sclerosis is very misleading because when you think lichen, you think plant, you think, and that's not the case. Lichen sclerosis is really kind of a nerve dysfunction in the skin. And what happens is your skin starts to turn white. You don't get good blood supply in there. And so the correct therapy for that is clobetasol, and they might have you. My mother has lichen sclerosis. They thought I had it for a while. Soaking in a warm but not hot bathtub with some baking soda might be very, very comforting, or Aveeno. Have you ever seen the Aveeno, the dissolvable Aveeno bath stuff?
No.
Let me get it. Hold on.
You can write it.
Thank you. She's gonna trust you. I've heard of it.
What did you say? Was Aveeno what? Yeah.
Is this your chance to ask people questions and find out stuff?
I just live with it.
Okay. So for people who have rectal pain, vulvodynia, urethral pain, this Aveeno soothing bath treatment.
Oh.
And it comes in a bag, and it's natural colloidal oatmeal. So it comes in a little bag like this, and you just dissolve it.
Okay.
Yeah. But the clobetasol is the correct.
Well, how long do you have to? I asked her how long do I have to take that? Do the cream, and she says probably for life. Like, because she said it could go into cancer. Do you know anything about that?
I certainly haven't talked to anybody in 27 years where it has gone into cancer, but that doesn't mean that I talk to people about that. So, I mean, I would do your research. Our goal here is to just calm the skin down. We want to calm that skin down, calm the nerves down. And so you also have to look at estrogen levels. Are you dry down there? Is there anything that can be done for that? Maybe, talk to her, see if she'd be happy with you doing a little bit of coconut oil or
olive oil. Oh, I've heard of. Coconut oil.
Yeah, coconut oil. And we have it in our store, but you can get that. You can get that at almost any store. Or this is called.
Oh, yes, I've tried that. A lady that my husband met, like in her 80s,
Yeah.
where he worked, she recommended it.
Yeah. And the thing about V Magic that's so cool, guys, for people watching, because I'm holding it up to the camera, is this is about as close to the natural consistency of your skin of anything, right? Don't you think? And it's very calming and soothing because it has sea buckthorn oil in it. And so this would be something else. So you have to kind of deal with the health of your skin, see if you've got some estrogen atrophy going on too. And I know the thing is here you've got other stuff going on, but you're probably laser focused on the lichen sclerosus right now because that's probably what's hurting you the most right now, right?
Well, I haven't been to my bladder doctor in years because I just live with the pain with the IC. But my primary care said maybe you need to see a new doctor. So I waited 3 months to see this doctor, specialist, urogynecologist.
Okay.
And I was going to talk to her about the IC, but when she went to go examine me, right away she went to the lichen and told me I had this. I had 3 biopsies. We never even discussed my IC, the pain and everything I'm going through.
And what's your results show?
It said that it wasn't cancer.
Yay! Okay,
Yeah,
we'll take that.
Yeah.
So in all likelihood, what it probably was estrogen atrophy. Your skin started getting dry. You didn't realize it was getting dry, and then it might have been being irritated by chemicals like laundry detergent. You know, what kind of laundry detergent do you use?
I use the Armor Hammer, the sensitive.
So that irritates me a little bit.
Oh, really?
I use the 7th generation Free and Clear.
Oh.
So
Really?
check that out. Do you wear any mini pads?
No, and I didn't have to until now. I just started the cream.
Okay, but normally you use a cream you use a cream at night. Well, you would use you would be using that in the morning too. Try not to wear a mini pad because the dryness of the mini pad is going to chafe against that skin and also pull moisture out of that skin. So if you can, it's just keep washing your underwear, wear it for an hour and then take it off and put on a fresh pair of underwear. Having a perineal wash bottle is important. Let me get that. Hold on. Ow. Oh, and there's my knee.
That's what kind of store she has.
What?
Hey, man, you're. When it comes to vulva, all things vulva.
I know.
At least I'll give you some things you can talk to your question. A wash bottle is really important because remember, when you urinate, that urine passes your vulva. And toilet tissue does not get a chemical residue off of your skin, as well as water. One of the most important things for you to do is have a peri bottle, fill it up with water, rinse yourself off first, get all the residue of the chemicals off of your skin, then pat dry. Okay, so this is important. And you're going to find this is going to be more important as you get older because your vulva is just going to be getting a little bit drier anyway.
Where do you find those bottles?
These are in our store for $2, $2.99. We've never raised the price on these in 20 years. We probably should. I don't know how much they cost us now, but anyway, all of our members get these for free. Because if you have,
how do you become a member? I'm not a member of your group.
You can go on over to our website and go into our store, and you can pick a membership over there.
Oh, okay.
What's the website?
The IC, it's icnetwork.com.
icnetwork.org or ic-network.com. We don't have icnetwork.com. Somebody stole that from me 25 years ago.
So I would go into IC Network.
You just go to our website, icnetwork.org or ic-network.com, and then click on our store, and you'll find the peri bottles under restroom supplies. And have a couple. Have one in every bathroom. Room temperature water, doesn't need to be refrigerated. You might find, though, that having it a little bit cooler, if you're noticing that your urine feels really hot, like it's burning you and burning that skin, immediately using cool water on that will reduce that discomfort very, very quickly. So this is another game changer. And I was at this 40 years ago at a vulvodynia support group meeting.
Wow.
I walked in and I was 21 or 22 years old, and this group of older women took their wing and they said, you got to get a peri bottle. And of anything I can suggest, this simple peri bottle to rinse your skin off is so incredibly important.
I've never heard of that. Wow.
Yeah, it's wonderful. Okay, so let's get back. Okay, so so we've got 1, 2, 3, 4. We got 5 people.
Go ahead.
I kind of want to dive a little bit into your early,
Yeah.
but we're only going to do it for like 5 minutes, and because I'm going to have to go to somebody else. But you've had quote unquote IC for how many years?
Since 2002, February of 2002.
Okay, and how old were you in 2002?
50 something? No, 50. Yeah.
Okay. And
Oh my God, I'm 68. I'm 68 now. 68.
Oh, 48. So you were probably perimenopausal.
Yeah.
Okay. Was there any sort of event that you associate with the onset of your symptoms?
No, my first symptom was I was at work and I had to go to the bathroom, and every time I went, I couldn't go, and then I couldn't even walk. So I called the doctor's office and they sent me down there, and they said I was in retention, which I didn't even know what retention was.
Okay.
So they catheterized me. I had to use a catheter for the weekend, and then I went back because I have a brother that has IC. He was diagnosed 10 years earlier.
Okay.
And so I had all those different tests you have where they put the water in you and you have to do all these tests. And then they went in and they found I had that I had IC, and then I had like ulcers, the Hummers you were saying something about on the mass wall, on the walls of my bladder. What do you call them? IC.
Hunner's lesions, Hunner's ulcers.
Yeah.
Yeah, but that's not genetic, hun. That's not
genetic.
That's not genetic. Hunner's ulcers are not genetic. So, at least we have no evidence right now that suggests that they're genetic. Do you have super sensitive skin?
Yes, yeah.
Do you have a wicked sense of smell? Can you smell things that other people can't smell, and do smells drive you crazy?
Yeah, a lot of stuff. Yeah.
Okay. Are you visually sensitive, where if there's a funky pattern in a carpet or a wallpaper, you have to close your eyes and turn away because it kind of makes you a little dizzy or woozy?
Not too bad.
Okay.
No.
Are you drug sensitive? Can you take a normal dose of a medication, or do you worry about side effects? Do you have to take half doses or quarter doses of that?
Like half, yeah, because like the first time I didn't know what bladder spasm was when I first got the IC.
Yeah.
And a girl from my support group, she gave me an Ativan, a lorazepam. She gave me half a pill. I was out cold.
Okay.
So I only take that when I have the bladder spasms.
Okay. Have you been sensitive your whole life?
I think so.
Are you a redhead? I can't tell.
No, it's kind of brownish.
Okay. Does your brother have red hair or blonde hair?
He did. Yep.
Okay.
Now he's got white hair. Yep.
And does he have super sensitive skin?
Yes.
Okay. So you're falling into 2 potential subtypes, in my opinion. Okay. So IC subtype 5, central sensitization, means that some of us are born with a more sensitive nervous system. And what do we know about redheads? Redheads have quantitatively more nerves. And some of the early research studies with IC found that people of a Northern European descent appeared to be more prone to IC. But now we understand why, because we understand that for some of us, we have a body-wide central sensitization, nerve sensitization. So what does that mean? It means that my bladder is perfectly healthy. You look at my bladder and it's a baby bladder. There's nothing physically wrong with my bladder. You put 100 and my bladder capacity is good, like 750 cc's. But you put 100 cc's of urine in my bladder, I have to pee right away. That's not true for a normal person. Somebody without this, you could put 500, 600 cc's of fluid in their bladder. They can walk around for a couple hours and not need to pee. You put 100 cc's of fluid in my bladder, I have to pee. Why? Because it's my nerves. My nerves are more sensitive. And so ancestry matters. ancestry matters, that every tribe had to have somebody who was a bit more sensitive. It's an evolutionary priority. They had to figure out what water was good versus bad and what food was good or bad. But it also goes back to, you know, how our bodies were built. My body, I'm 95% Norwegian Swedish, northern Norwegian Swedish. I mean, we're talking North Pole. What were my ancestors eating for generations and generations? They were eating seals, whales, fish, and maybe berries. That's it. There was no coffee. There was no citrus. There was no acid other than fruit once a year that wasn't ripe. So when you consider the concept of evolutionary adaptation, our bodies are the direct results of what our ancestors were exposed to. I have terrible reactions to oatmeal and chocolate.
Chocolate.
Yeah, I mean, they kill me. I get terrible spasms. Why? Because chocolate comes from Africa. My body, my lineage wasn't exposed to chocolate until maybe the last 800 years. So my body interprets chocolate as poison. Exactly. And so that's the landscape. That's the foundation. You and I have a more sensitive nervous system. It is what it is. It's not a disease. And the odds are you've already adapted your daily life. You probably don't have scented candles in your home or Febreze in your home. You probably have already just naturally tried to make your environment better for you as a person. And that's what we have to do. Life in 2021 for somebody who's sensitive is hard. We have a lot of chemicals in our daily life that trigger us. We have a lot of stress. We've got the internet. I mean, every single moment can be challenging for one reason or another. It's not like the old days where they sat on top of a hill for hours with their reindeer, looking around and basically breathing. We have stress and things that can trigger our nervous system at almost any given time. Can you do caffeine?
I don't drink coffee. No.
Yeah. If I
have chocolate, that's caffeine. Right?
Yeah, not as much. But
I don't drink coffee. I live on water. Since I got IC, I just drink water.
Yeah, but so your subtype, you can't just say IC anymore. IC doesn't really mean anything. We have to try to have a more specific diagnosis. What do you say?
No, I was trying to tell you one of those pillows that you showed.
Right.
I got sit with that.
Okay. Okay. So
I just learned to live with all these things that I have. That's all.
Yeah. Come on over to our website and watch my video on the 5 subtypes of IC. I think that you will find that very, very useful. One of the reasons why I think it's so important to emphasize this is that none of this is your fault. You've done nothing wrong. You are not damaged goods. You are not to blame. There is no shame. Inheritance is inheritance. You and I are the result of our ancestry. We are more sensitive. It is what it is. And it is our job on a daily basis to protect our bodies. So that wouldn't have caused the retention, though. And this all began with retention.
Yes, I was at work and I had to go to the bathroom. Every time I went, I couldn't go. I was getting bloated and I couldn't walk. So they said they go right down to the doctors. And when I did, they said, you're in retention. It was 4th of July weekend.
Retention can happen, number one, if your nerves are messed up, but it doesn't, but more importantly, or more likely, it's because your pelvic floor muscles were very, very tight.
I remember when we were in Maine and we worked on my home. That's how it first kind of started. I got rid of the bathroom, pull, and you couldn't go.
Oh, that was after I had it. Yeah. He's telling me there was one time we were on vacation and I had to have him pull over because I had to go. The pain was so bad. And then I didn't have to go. I get that like that too. Do you get that?
Yeah, I totally get that. So it would be very interesting for you to have a pelvic floor assessment. It would be very interesting to see what is going on with your muscles. Because being sensitive doesn't trigger IC. Being sensitive just makes us a little bit more vulnerable to our daily lives and what we're dealing with. Usually what we can find is some sort of trauma which amped up your nervous system in some way. So do you remember falling? Were you in a car accident? Did you have a difficult delivery? Anything at all like that?
I've never had children. I don't know I don't remember when I was younger, but I have fallen in the last 10 years.
On your tailbone. You ever fall
Yeah.
on your tailbone?
My back in the truck, out of the truck. Remember I fell in the truck?
So
my husband.
So that's the triggering. That is what we most consistently find is a triggering injury for the whole pelvic pain for many people is a tailbone injury. You fall on your tailbone. It traumatizes the muscles. It traumatizes the nerves. It traumatizes the blood vessels. And so, I'm guessing here, and we won't know until you have a pelvic floor assessment. But I think that you would find this book really, really, really breaking through chronic pelvic pain. It's free on Kindle Unlimited.
Kindle Unlimited?
Yeah. It's just a Kindle. It's a Kindle Unlimited program where you get free books every month. You get to pick books for free. And you can sign up for 30 days free. So, and then you can just cancel it. I think it's like $7 a month. But this would be a very, very good investment for you to read so that you can really try to understand, think about any traumas you had and how that might be impacting it. And it also might relate to your lichen sclerosis, because if your muscles are super tight, that means blood flow is diminished to the vulva and to the bladder and to the urethra. And so you might find the chapter on vulvodynia really, really interesting. There's also a section in here on pudendal neuralgia and unprovoked vulvar pain. I do believe he talks a little bit about lichen sclerosis. But the foundation for all of that, as he says right here, inflammation of the vulvar tissues from infections, allergies, or skin sensitivity reactions can also create tension in the underlying muscles, which then maintains sensitivity in the vulvar tissues. So you got to get this book and check this book out. Okay.
I wrote it down.
Okay, hon. Listen, I'm running out of time. I've got to run on,
No,
but
that's all right. I appreciate it.
Please keep in touch. I'd love to hear from you again.
I just want to tell you that I went to the physical therapy, and she said I have good Kegels. So would that mean my pelvic floor is good if I have good Kegel muscles?
No, because if normally you don't do Kegels if your muscles are tight. If you can do like for me, if I do a Kegel right now, which I'm doing right now, piece cake, I can tighten the muscles like that, but it takes a couple of seconds for them to relax.
Right.
And it's the relaxation phase. The longer the relaxation, it means your muscles are kind of prone to being a little bit more tight. And so,
right, so I should ask them to do a pelvic floor assessment?
Yeah, it would to see if you've got anything else going on. Because if you're holding your muscles tight to avoid leaking, you're basically creating pelvic floor dysfunction.
No, I don't have that. I never had the leakage.
The muscle should be long and loose and pliant. They shouldn't be tight and rigid. They should be long and loose. Flat, long and loose, if that makes sense. Kinda?
When's the next time she's going to be on?
She's going to go to other people now. When's the next time you're going to be on?
I'm usually on Sundays, and then I do drop-in meetings. Make sure you subscribe to our YouTube channel and our Facebook channel, because I'm doing drop-in meetings, and the internet connections are being a real pill right now. So I might even have to split meetings up. So
on Facebook.
Just go facebook.com / interstitial cystitis network takes us to you. You just have to spell interstitial cystitis correctly.
No, he's all set.
So it's
interstitial cystitis.network.
No dots. No, interstitial. Facebook.com / interstitial cystitis network. Or you can just go on over to our page and click on the Facebook link right there too. Okay?
Okay. All right. Thank you,
hon.
Thank you.
All right, Julianne. Julianne, I'm sorry for my false start to you earlier. How are you, hon? How are you today?
I am hanging in there.
You're hanging in there. Are you better or worse than you were last?
I am doing a little bit better because I quit my job.
Okay.
but I have been experiencing a lot more lower back pain. I can't be sitting for too long. I can't even lay down for too long anymore.
So, that lower back pain is not your back. I mean, it's not your bladder, right? So refresh my memory. What's wrong with your back? Do you know?
I did have a spill down the stairs very often growing up.
Okay.
And you also touched on something today that also brought up my memory. My parents used to smoke a lot when I was younger too.
Okay, yeah, but that wouldn't cause back pain.
Mm-hmm.
And that wouldn't cause pain with sitting and pain when lying down, hun. There's something you need to talk to somebody about your back. I mean, go to your primary care and tell them that you've got back pain, show them where it is, and ask for a referral to a physiatrist or an orthopedic surgeon so that you can have a proper back examination so they can try to figure it out. And you need to tell them that you fell down the stairs a couple of times. I mean, that's really, really, really important here. Okay.
Yeah.
And odds are they're probably going to want to do x-rays or an MRI. I just had an MRI in December. And, you know, your symptoms are they are severe enough that I think you need to be checked out fairly quickly. Okay. I mean, I don't want you laying at home suffering with back pain for a long period of time. You got to ask your doctor for help, show him where it hurts, because you need to work. You know, we need to make sure that you can work and support yourself. You have to quit your job. That concerns me. And so we want to find out if it's a muscular issue or a skeletal issue and what the correct therapy is for that. Okay.
Well, a lot of the reason why I quit my job, Joe, is because it was too stressful for me.
Yeah.
Like my job was so demanding and so stressful that my bladder and my pelvic floor was always messed up while I was working.
I get it. Yeah, I get it. And you know, here, hold on. Somebody's saying something here. Boria is saying, had lower back pain, was operated on, still have back pain and no control. Boria, are you saying a urinary control or bowel control? Here. It's always nice when people on the other services step in with comments. You know, when I lost my job, understand I hated my job. Because I gave up pharmacology, I was waiting to start my PhD, and I took a job with a nonprofit, what was supposed to be a happy job with a nonprofit, fundraising for a year before I could get back into grad school. And it was miserable. I hated every minute of it. And I think that sometimes when you have to close a door, you always have to remember that the sky is the limit with respect to new opportunities. And I always tell patients, listen, the job wasn't for you, it didn't work for you. Think big now. What job would you love to do? What job would you would wake up every morning excited to go to work? You wouldn't even consider it work because it's so much fun. This is a great opportunity for you to do a little bit of kind of thought, a kind of thoughtful planning here on what would be a better job for you? What would be a job that would lift your spirits? What would be a job that would really match you well? And then when you have an idea, be bold, man. If you wanted to work for a movie studio, call Lucasfilm. You know, I mean, be the squeaky wheel gets the grease. Be bold, and mighty forces shall come to thy aid. And that was something that I really struggled with in college, as I was not bold. I was kind of condemning myself to work with local stuff instead of dreaming big and doing regional national stuff. And of course, that's now what I do. I don't limit myself in that way. I think you shouldn't limit yourself either, too. So I call your doctor tomorrow and let him know you're having back pain and you can't sit down. When you sit down, you got to stand up. Okay. All right, hon. Mel, are you there?
Hi.
Hey, girl, how Okay.
Well, I'm fine. I'm sorry. I was just listening in.
Okay, that's okay. If you want to listen.
But I'll tell people I recently went to Dr. Peters also, and I live about 4 hours away. I went when I was still somewhat okay. I've been going to a urologist who did a cystoscopy to remove my ulcers about every 5 to 6 months. They always helped, but she retired. So I was left, and she knew no one else around that could do that for me. So I went to Dr. Peters. I'm again right now. It's only 2 months out, so I'm doing very well. So I'm just waiting now to see. In the next 2 or 3 months, hopefully, I'm on cyclosporin.
Okay.
And so I'm just hoping that everything holds good.
So cyclosporin, I didn't mention because we haven't gone through the treatment options so much. Cyclosporin. And I think Dr. Peters would say this is kind of a miracle drug for some patients. That for patients who have extreme inflammation and or just the typical therapies are not working for them for one reason or another, that cyclosporin has been absolutely life-changing for some. And I'm thinking of a good friend of mine who is on Facebook, who I've known for years. She very severe patient, and she was still working. She's a high school teacher, and she was doing bladder installations at work. And I mean, I don't know how she did it. I could not have done what she had done with severe IC, continuing to work. And they finally suggested cyclosporin, and it has completely changed her life. She is not requiring any bladder installations. Her pain levels are dramatically down. The big challenge with cyclosporin is it does make you a little bit more immune compromised. So, and urologists don't do it. You've got to go to a different doctor to normally have it done. That's really viable. I mean, we have really good success stories with cyclosporin now. It used to be a scary therapy. We don't consider it scary anymore.
Yeah, apparently they're using a relatively low dose.
Yeah, extreme. But
you started kind of high, but then they titrate you down pretty quickly.
Right.
So anyway, I'm doing real well. So you can go on to someone who needs your help.
Okay.
I just like to listen in.
Okay. All right. Slajana, I don't know if that's the right way to pronounce your name.
Yes, it is. Yes, thank you. So nice to meet you. I'm sorry, I don't know if I don't have light at all here in this room, so I don't think that will help.
Okay, that's
but
okay.
If you don't mind, if we can talk like this, then I'm calling you from Europe, from the Netherlands.
Yes.
And I this is my very first time. I'm meeting you for the first time, or I hear you for the first time. And I'm so impressed by everything that you said that I hardly have words, really. And your knowledge and everything you say. Anyway, I am 65 years old. In a few months, I will be 66. And I was diagnosed with IC 11 years ago. So sort of I was... what I heard, you mentioned those things. I had very severe endometriosis as a young woman.
Okay.
And I have a spasmic colon, this, how do you call it? Irritable bowel syndrome.
Okay.
So, and for me, it's not so much the pain, although the pain is also, but it's more vaginal and it's more on the urethra. It's more on the, and it is what I heard also from you this evening, and I'm so impressed. For me, it's more after I go to the toilet and pee, and then it becomes, and it's more those cramps.
Okay, where?
It's like
where does it hurt the most after you're done peeing?
It is, I don't know if I can explain that to you very well, but it's almost like with a very sharp fingernails, and then you pinch. It's sort of like this pinching, and it's like a straight line from the bladder to the urethra. and it goes almost to the navel, and so to that.
So this pain is internal rather than external. It's not on the skin, it's inside of your body.
Yes.
And does it happen? Does it start as the last couple of drops are coming out of your urethra?
No, when I'm finished and I get up and I come into the room and I try to sit, and then it gets to this pinching.
It's
really.
okay, so it's a pinching sensation.
I think I'm not sure. I know the exact.
Okay.
Word.
Are you straining to empty your bladder? Are you pushing?
No. Sometimes it's really very, it goes really well, and I have a lot of flow and a lot of volume, and I'm thinking, oh, beautiful. And then after that, it gets really bad.
Do you, okay. Do you stop and start as you're peeing? Like stop, pee a couple drops, stop, pee a couple drops, stop, pee a couple drops, stop?
No, I don't.
Okay. When you're done peeing, do you find that when you stand up, you still feel a little bit of urine, so you sit back down again and pee a little bit more?
No, I can relieve myself quite thoroughly or completely. So, but it's yes, and it's and the pain, it changes. Sometimes it's like a scratching. It's like scratching. Sometimes it's like it's pinching. Sometimes it's just this unpleasant pain.
Do you ever have pain?
But it's more the urgency and the pressure with me.
Okay.
It's the pressure, always that feeling that I have to go to the toilet.
Do you have, is that the only time the pain happens, after you're done peeing, or does it happen at other times too?
At night sometimes, mostly in the evening, it begins, that pinching. And sometimes while I sleep, I can feel that horrible pressuring and unpleasant.
Is it positional? Do you notice that it gets or laying down on one side or the other side? Is it?
For example, now while I was listening to you, I'm sitting, and while I sit, I don't feel almost anything. Just this uncomfortable, little bit painful sensation in my urethra. And whenever I start to get up to make that pressure to get up, then it gets, then it's pinching like that.
Well, you need a pelvic floor assessment, hon. I mean, that's not IC. That's not your bladder wall. Bladder wall pain. If you had a profound injury on your bladder wall, you would have pain as your bladder filled with urine that was relieved by urination. So you're not you are not describing bladder wall pain at all. At all.
Okay.
To me, it sounds.
I don't know. I'm at the end of my life.
No, I mean, you said you had severe endometriosis, right?
Yes.
So
they helped me on hormones almost all my life.
Have you had a hysterectomy?
No.
Do you know if the endometriosis attached to your bladder?
No, nobody told me that. None of my urologists. But I do know that on my ovaries, at least on the right side, there is still this cyst. But my gynecologist said, I don't want to do anything with that. I'll just leave it alone.
Well, they've got to explain your symptom, though. I mean, you need to let them know that you're having this symptom and that it all happens after urination, literally a couple of minutes after urination. It's a sharp pinching sensation. You know, I don't know what that is. I mean, I have to wonder if you have, do you feel like you're carrying a bowling ball around in your pelvis? Do you ever feel a heaviness? Like a really big heavy weight in your pelvis?
No, not really.
Okay.
It's I've always had what is it called in English? Bladder infections. and those, that typical pain and cramps, and then like whenever I finish peeing, it just go through my whole body to the head.
Well, a bladder spasm. The reason why I asked you if you had,
Yeah, spasm is that.
yeah, but
Yeah.
bladder spasms normally happen as the last couple of drops of urine are coming out of your urethra.
Okay.
And they will shoot up your spine and down your legs, and you're literally bent over for a couple of minutes while your bladder is spasming like mad. I don't know. I've never had anybody describe it the way you've described it. But when I hear
Oh,
pinching,
I'm so sorry, because
well,
yeah,
I think it's
maybe I'm not saying it correctly.
well,
I'm trying my best to explain how that feels.
I know, but the way you're describing it is not pointing to the bladder wall. If it were a bladder wall issue, you would have pain as your bladder filled with urine that was relieved by urination. You're not having that. You're having pain 2 to 3 to 4 minutes after you're done peeing. And that's what that's what you got to tell the doctor, and that's what they've got to try to figure out. Okay.
Yes, I have to go now. I made actually contact with a special clinic here in the Netherlands, in Den Haag. They deal with this issue, and yes, but I saw you tonight, and I was sort of like my mouth was open almost the whole time while you were
well,
speaking.
also there is a Netherlands IC patient organization. If you didn't know
Yes,
that,
I know. I got you actually your site through that organization. Yes.
good.
Oh, you see, you know that.
Good.
And I'm sorry, I just asked you that question about the Sister Q and the bladder Q. I heard that from a patient also from here, and I didn't hear your answer. Actually, you froze while you were answering.
So neither. I mean, in your case, you know, your symptoms are unusual enough that it's impossible to make a recommendation without knowing more. I will just tell you that if we're dealing with estrogen atrophy, and at your age, we would also be dealing with estrogen atrophy to a certain degree, we want something with chondroitin, and neither one of those have chondroitin in them. So we don't, those are.
What would be the, just like a feeling? I know you cannot say anything more specific. What
so
would be?
Go to our website and go into our store. You can see Bladder Builder, Bladder Rest, Cysto Renew. There's a manufacturer's delay on that. Cysto Protect. I'm going to type a website into the chat here, algonaut.com. They're the people who originally developed Cysto Protect, and they retained their international shipping. So they may be able to, they cannot ship to anybody in the US, but they might be able to ship you Cysto Protect to the Netherlands. Or
yes, now you reminded me, many years ago, I ordered Cysto Protect from I saw it on your site, and my feeling was when I started using it, it got worse, actually, my symptoms and the pain and everything. And I stopped it. I ordered 3 or I don't know how many bottles, and I basically threw them away after that.
Well, you could have been having a reaction to an ingredient, but it's like I said, you're an anatomical mystery to be solved, and your symptom is a very usual symptom. And I think that you need to ask your doctor where this pain is originating from. I mean, you have to be very, very specific with them. Don't walk in and say you have IC. Please walk in and instead say, listen, every time I urinate, about 3 minutes afterwards, I get this really weird pinching pain right here. Can you please help me understand what that is? And then based upon that, then we might have some better suggestions for you. Okay.
Yeah.
Okay, hon. Nice talking with you. I have to move on. I'm going to come to Nikki now.
All right. Thank you.
You're welcome. Hi, Nikki. How are you doing today? Uh-oh, I just lost you. Yes, I can. How are you, girl? How is life?
I'm okay. I was diagnosed officially with IC 2 weeks ago.
Okay.
I went to and I was diagnosed with pelvic floor dysfunction in May 2020.
Okay.
So kind of like what kicked it off in like December 2019, I had what I thought was a UTI. I went back right at the beginning of COVID lockdown, thought I had a UTI. They gave me more antibiotics. So I kind of got it into it with the fake like UTI track, like I was taking antibiotics.
Right.
So I was kind of wondering what my subtypes were, because tomorrow is the first time I've seen my urologist after I had a cyst with hyperdistension 2 weeks ago.
Okay.
So it's my like follow up is like a doctor that describes like Elmeron for treatment. So I want to go in like educated to know I don't want to take Elmeron. Like this is what I think my subtype is. How can you help me?
Oh, well, okay. And the odds are your doctor isn't even going to know anything about the subtyping. I mean, the subtyping is really only done at the top tier of doctors. And some of them have their own system, they don't even use the pain system. So take me back in time. So you were diagnosed with pelvic floor dysfunction last year, but but you said something about 2019. What happened 2 years ago?
2 years ago, I had what felt like a UTI. I've had UTIs in the past. So when I went to like my general practitioner, he didn't find anything. He just said I had high, like, however you say it, leukocytes or whatever.
Leukocytes. Yeah. Okay.
And he just gave me medicine, and it did kind of go away until 4 months later, it flared right back up.
Okay. So how old are you?
I'm 33.
Okay.
Actually, my urologist, she was convinced like a year ago that I didn't have IC, because she said that she doesn't see someone as old as me actually be diagnosed, which I thought was kind of interesting.
That's odd. Okay. That's
but
odd.
when she looked at my bladder, she showed me pictures. She was like, actually, you're very irritated and inflamed. So I see a bladder wall problem.
Well, so we have to ask ourselves, why would it be inflamed? Okay, so I call it, which comes first, the bladder or the pelvic floor? You got both. But we have to try to figure out which one's primary and which one's secondary. So in the fact you say you have a history of UTIs, right? You've had a history of, or potentially flares. You just didn't know they were flares. The bladder only knows one language: frequency, urgency, pressure, pain. So everything feels like a UTI. A bullet wound would feel like a UTI. So, okay.
And I've had those classic symptoms, like you just said, like urgency, frequency, pain, burning, pressure for a year now. I sometimes have flares from food. Food and stress seem to be my two numbers.
Okay. So,
two biggest stressors.
Were you an athlete?
I was not. I did have, the only thing I really can think of in 2016, December 2016, I had my son. I was in labor for like 40 hours. I had like 2nd degree tear.
Okay.
That's really all I can.
All right.
That's what I can think of.
Well, okay. And can you remember any other physical traumas? Can you remember falling on your tailbone, car accidents, abuse, anything at all like that would have given you trauma? Okay. So it's not unusual for women to say that their symptoms began after a difficult childbirth. And the fact that you suffered a tear tells us you experienced significant trauma to your pelvic floor. And so what happens, and let's see, muscles are normally long and lean. They're flat, long, and lean. A tight muscle, and guys, my bicep has disappeared. But normally if you had it, you would have a bicep here. My bicep is gone right now. And I even did weights yesterday a little bit. And that's a sign that this muscle has now contracted. And muscle fibers do this, right? So when they're tight, they're in this position. When they relax, they're in this position. So after injury, what happens sometimes is because the muscle is weak, it then overcompensates and it stays tight.
Mm-hmm.
And you have trigger points.
Yes, I do have trigger points. They do help with the wand.
Right.
I've seen a pelvic floor physical therapist for almost a year now, actually, and she was the one that said pelvic floor.
So
dysfunction.
have your symptoms gotten better with your physical therapy?
They do. They kind of wax and wane, I would say. I mean, I have had a full month since I've been diagnosed in the last year where I've had almost no symptoms, but then sometimes I'll flare lately. Normally I know if I've eaten something wrong or just a stressful event happened, but lately I just feel like a bee sting feeling in the bladder that I can't really relate to anything other than just saying like, okay, I guess this is like an icy flare, but I'm not really sure where it's coming from.
A bee sting. Where is the bee sting specifically? Describe it on your body. Where do you feel the bee sting?
It kind of feels like in my bladder area, like it's tender, like on the outside of my stomach, and on the inside, like I feel like I have urine sitting in my bladder, like the bottom little bit has like urine in it, and it feels like a bee sting feeling.
In your urethra?
Like
is it low, like down by your urethra? Because sometimes when the urethra gets irritated, it zaps you. You're walking along and all of a sudden
really
it's like, woo.
Right. It's not really urethra feeling. It's like a deep, like inside feeling.
So if I were to guess and again, this is just an educated guess, but we've seen it many, many times, that you sustained a pretty significant muscle injury during the childbirth. You ended up with long-term muscle weakness trigger points. The consequence of the trigger points is reduced blood flow to the bladder, as well as, it's impossible for nerves to be healthy if they don't have good blood supply. And this points. And he says in here, the challenge here is as long as that muscle has a trigger point in it, it cannot be healthy. And so here is an example. These are two pictures of trigger points. So we've got the muscle fibers. And if you look close for the trigger point right here, look at what it's doing to the blood vessel. It's squeezing the blood vessel.
Yeah, that makes sense.
And
when she does physical therapy, like on one side, she always thought it was strange and nobody in the office could really figure it out. But like if you pressed on one trigger point, my like right side would numb, like it would shoot numb down the right side. Like it was
the right side of like the right side of
like
what?
The right side of my like inner thigh would go numb.
Okay, that scares me a little bit. She's not doing that a lot, is she?
No.
Okay. I have that. I have numbness on my inner thigh and my inner knee because of a 2 ruptured discs in my back. Like literally right now, I have it.
I do know, like when my pain acts up, she says like my SI joint is part of the problem.
Okay, so there we go. I don't know if you watched the first part of the meeting, but we talked about bony structures and how bony structures will cause long-term chronic muscle tension. So now you're clicking more muscle trauma boxes here.
Yeah.
And so, we have,
which makes sense that I was diagnosed with a pelvic floor dysfunction before
the
IC came about.
Right. So what's exciting here is that what's exciting here is that you're working with a good physical therapist. You can see the effects. You just didn't understand how they connected to your bladder, but it will. As long as you have trigger points, your other tissues are not going to have good blood supply. So you're working on the trigger points. The question, and he answers this in this book, is why do the trigger points keep coming back?
Right.
And they keep coming back because you have a problem with your SI joint, just like I do.
Mm-hmm.
Right. And so now we have to figure out what can be done to help stabilize that SI joint. It might be steroid injections, or it might be They might actually do something with a ligament, and that's what I'm waiting for. It's called prolotherapy, because my ligament that helps keep that joint together with the muscles is very loose because I overstretched it. And so with prolotherapy, what they do is they inject something into the ligament that causes the ligament to tighten up the joint. So, you're checking a lot of musculoskeletal boxes for me, to be quite honest.
Right.
And
do you think because I was wondering, because it started with a UTI, if that would be considered like a subtype 2.
no,
Because I do take things like aloe. I do find that helps a lot.
well,
But I
okay.
know the muscular stuff.
Okay, so remember, chicken versus the egg dilemma, both. But one is normally triggering the other. So
Right.
if you were a chemotherapy patient and your bladder was damaged by you were drinking way too much diet soda, then our therapeutic so your bladder, while screaming in pain from the chemical irritation, and your muscles fight to protect you. Our therapeutic priority for that patient is going to be to calm and soothe the bladder wall, to get rid of the chemical irritation, hoping too that as we get rid of the chemical irritation, the bladder starts to calm, the muscles will relax. Okay, so that's easy. That's the Elmeron patient. That's not you. You're in the other group. Your symptoms, your first symptom was muscle-driven symptom, and at the same time, you're now diagnosed with an SI joint issue. And we know the consequence of long-term muscle tension is an eventual dysfunction in the bladder. So muscle first, bladder second. You could be put on bladder therapies for 20 years and never get better, because it doesn't address the fundamental issue, which is poor blood supply. And the poor blood supply is because you have tight muscles. And so our therapeutic,
and I have anxiety, and I have had it for like 16 years.
Yeah. So our therapeutic priority for you is to restore blood flow. We just need to get those muscles healthy again. And as we get those muscles healthy again and the bladder starts getting good blood supply, there you go. Sarah here on Facebook says, oh my God, I'm drinking Diet Dr. Pepper. Sarah, pick it up, go put it down the drain right now. You may never, ever, 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 ever drink diet anything. NutraSweet is metabolized into formic acid, a precursor to formaldehyde. You get a double whammy of acid when you do diet drinks. Seriously, get a LaCroix sparkling water. That's way better for you than a Diet Dr. Pepper. Okay.
One last question, Jill. If you think I have a poor like blood supply, what can they do to help something like that?
Well, pelvic floor physical therapy to relax those muscles. And again, you need to get this so you understand the anatomy a little bit more. But I think we also have to work on your anxiety, girl, because whenever you're anxious, you're tightening muscles. You are subconsciously tightening muscles when you're stressed. And
you mentioned a course that you took that was really helpful. Do they still have that course around?
No, it's called Phobies. You can find some of the old materials on Amazon. This is back in the old photocopy days. And I should try to buy the license rights for that. I really should, because I'd like to resurrect it. Fantastic program. Check on Amazon. In essence, what they say is the secret to controlling anxiety is to control adrenaline. That adrenaline is what amps everything up. That when you're under stress, when you see that saber-tooth tiger, you get a shot of adrenaline in addition to muscles getting tight and all that sort of stuff. And the problem is now that you have chronic anxiety, as I had chronic anxiety, pretty much every other thought is a negative thought, right? Right. Yeah, girl. Preaching to the choir here. You can't.
You could catastrophize.
Oh yeah, yeah. You could, and I've done quite a bit more catastrophizing this week than normal. So here's the problem: is every time you have a negative thought, you give yourself a jolt of adrenaline. And the thing is that you're having probably hundreds of negative thoughts every day, and you're stuck there. And you got so much adrenaline shooting through your body that's what drives the tears. That's what perpetuates more anxiety. And it's just chemical chaos in your body. So what we have to do is we got to reduce the adrenaline, and it's really easy to do. And this is what the class taught. The secret to controlling anxiety is to control adrenaline. And I just want to say that one of the reasons why I didn't talk about it when I was younger, and I took the class when I was 35, by the way.
What was the class called again? You said
Phobies, like phobia, EASE, phobies. My even with a master's in psychology, which I have, when I was younger, because I had a neighbor that was murdered. Okay, and so I did not want to jump that. It was traumatic for all of us. It's still traumatic to a certain degree. And what the phobies class said is really, it's not about psychotherapy. It's about giving you the skill to control the adrenaline. If we can give you the skill to control the adrenaline, everything will calm down. And then if you want to do the psychotherapy later, that's fine. But let's just try to get all the adrenaline out of your bloodstream first. So this is how we do it. You have a negative thought. The very first thing you do is just close your eyes, visualize a stop sign, just like stop, right? Then take a nice, slow, deep breath in for 3 and out for 3. So that oxygen just rendered that adrenaline shot from that negative thought neutral. Done. Over. Oxygen renders adrenaline chemically neutral. So you have the negative, scary thought like, oh my God, I'm never going to have front teeth again. Okay. Stop. Stop sign. Deep breath in. Out. I've just turned that adrenaline off. Okay. Have something that you say to yourself to thought. It has no freaking power. It's just driven by adrenaline. So what I say is, oh my God, Jill, you're not God. You can't predict the future. For all you know, the next set of teeth they give you is going to be a fantastic set of front teeth, and it's going to go like that. Because that's my current trauma, is getting my front teeth replaced. All right. So stop sign, deep breath, minimize the thought. Oh my God, Jill, you're not God. You can't predict the world. For all you know, tomorrow is going to be a fantastic day. That's what I say to myself. Now, they sent us home and they said, now listen, we have one goal: to reduce the adrenaline. Every single time you have a negative thought, you have to do this. And we're warning you now, you're going to do it hundreds of times. And like, oh my God, when I really paid attention, like every other thought was a catastrophe. I was catastrophizing about everything. So easily the first day I did it 100 times. Second day, I was still doing it, maybe 50 times. Third day, maybe 25 times. By the end of the week, I was doing it once a day. And you know what? For the first time in a decade, I was calm. It was stunning, Nikki. It was stunning how successful it was, and how that constant drip of adrenaline into our bloodstream just winds everything up. And when you wind it down, it's like, oh my God, I can breathe again. Oh my God.
Yeah. That makes so much sense, because over the summer was the best I've probably ever felt. And I was doing yoga outdoors 2 times a week. And it felt like between physical therapy and yoga, it was really helping.
Oh yeah. And so, that's my go-to: stop sign, deep breath, minimize the thought. And I'm really, really good at it now. But I still have moments when I still get tweaked every now and then. And I really have to, I heard something in my garage on Wednesday night at midnight, and I thought it was a rat. And I hate rats. And we have massive rats out here right now in California because of the fires. They're just everywhere. And I for 18 hours, I didn't sleep. And then I called the pest control company. And then I taught myself how to use a rat trap, set it up. I was obsessing for 18 hours. It was a damn trellis I'd put on the outside of my garage. There was nothing in my garage, no rat. And for 18, for at least 18 hours, I was panicking about it. I was ruminating. Ruminating is when you can't stop thinking about it. Right? And so again, stop sign, deep breath, minimize the thought. That's the best thing you can do. Okay?
Thank you so much.
I hope that helps a little bit. I mean, I think we can all see we're all human. No shame, no blame. It is what it is. It happened. We have, and as he said in the phobies classes, the phobies class was created by a surgeon who had massive anxiety, and he was trying to be a surgeon, and for his son. And he created it for his son. And what I loved about the class is he just took all the shame away. It's like, you know what? Listen, this is what happens with stress. This is what happens with trauma. You've done nothing wrong. It's when what we can do is we can control it now. We can control it with that stop sign, deep breath, minimize the thought. Okay?
Thank you, Jill.
Okay, hon. Nice talking to you. Please keep in touch. Please keep. I would love to hear what they say. Okay?
Okay. Thank you, Jill.
Okay. All right, Cindy. And then Debbie, we're coming to you last.
Jill, I just wanted to show you, I did the chalkboard thing.
Oh, you did?
See if I can show you all my little check marks for the week.
I love it.
That's really all I needed to say.
I love it. And isn't it?
And I've been doing more teas instead of coffee. And I'm really watching what I'm doing. So it helped a lot.
I'm so glad. And my newsletter I just sent out, I talked about this herbal coffee called Dandy Blend. And like we almost
dandelions, because I love dandelion.
Yeah. The dandelion has a lot of an underlying sweetness to it. So what they do is they roast barley, rye, chicory root, dandelion, and sugar beet, and then they take extracts and of it. And so it's only got 1 gram. It's got 1 gram of sugar in it, 0 grams of fat, 0.1 grams of protein. Anyway, one of the things that's so interesting about that is they were talking about how it's actually kind of soothing to an irritated gut. So
that'd be great for you.
Yeah. So I think that's a dandelion portion of it. So Dandy Blend, give that a shot.
I sent for on the website the white chocolate, hot chocolate.
Yeah. Well, give it a try. And we have 2 more, but I haven't put them in the store. This is part of the box. I got cookies and cream. Just to try, because there's very, very little chocolate in it. I mean, like it's not even in the form of regular chocolate. And it's white chocolate, right? So this is a white chocolate.
Good to know too.
And then the other one I got, because I'm just really trying to add stuff, is white chocolate with mint.
Oh, that's that on the web.
Not yet. Not yet. I've got to put them up tonight or tomorrow or Tuesday.
Awesome.
I will try to get these up. So for people who love hot chocolate, you know, the white chocolate doesn't have any of the cocoa solids and butter, for lack of a better term. So
that's something to substitute.
Yeah.
What I was. But it really helped me focus, and I really appreciate you.
Good. You're very, very welcome. I'm glad to be there. Please keep in touch. I want to see that filled up.
It's great. I keep every day. I'm like, I did it again. It's great.
Yes. Awesome. All right, hon. Thanks for checking in.
Take care.
All right. Debbie. Hello,
Hi.
Debbie. How are you, girl? How's life?
Okay, I hope your leg feels better.
Oh, I don't know. Okay.
I know spine stuff and pain. Believe me, I can relate to everything related to spine pain because I am a former ACDF survivor.
Right. Well, they've told me that it's healing and scarring over, but it's very hard for me not to bend over and do stuff, you know. That's
I know.
and
I
I'm
know.
trying not to. He told me I could lift one supermarket bag. So
Oh, gee.
so we'll see. Well, anyway, what can I do for you today, hon?
Well, I really came on to just, listen and learn, and because I love listening to you since I finally found you. I guess I'm kind of newbie, and I'm maybe newbie to IC too, or I don't know. Maybe I had it on and off my whole life. I had urinary tracts here and there. I don't know what's going on. I just wanted to let you know that I still got the pain in the belly, the bloated and cramping, and the feeling I have to pee all the time, but I am drinking water, and I'm trying to cut out the chocolate and all the natural soda, and I am vegetarian, and I started eating meat, and now I'm changing my diet, but I can't get a urologist phone video appointment till March 26th. So I wanted to ask you, in the meantime, besides I'm taking aloe pills, I'm taking D-manganese. I'm taking
Wait. Hold on again. So did you say, okay, you're taking aloe, and then
aloe pills.
And then what did you say after that? Manganese?
No, D-manganese. It's like a powder, a cranberry thing that you
so D-mannose. So
yeah, that is. Sorry.
Okay, so that's to prevent E. coli infection. Okay, and what was the third thing that you were taking?
Pumpkin seed oil and probiotics and vitamin C and
wait. Taking vitamin C?
A little bit.
Why?
Not all the time.
Why?
Not all the time.
Why?
I don't know. I just thought the vitamin C would help me.
No, it will make it worse.
Okay, I can stop.
Can you go get the bottle of vitamin C you're taking?
Hold on.
You're on your phone. Go get it.
Okay.
All right, my friends. Now listen, vitamin C, also known as ascorbic acid, is extremely irritating to a tender, wounded bladder. The only vitamin C you can get away with might be an ester C. Oh, okay. Okay.
I try to buy pure stuff that's natural and powder and all that.
Okay, so you are doing the low acid ester. How much of that are you doing? What's the
I don't know. I just throw a sprinkle of stuff. I don't measure. I just throw it in with my water.
I mean, some people react even to low acid vitamin C. I wouldn't add that right now, because you're still trying to figure out what's going on.
Yeah.
And I mean, you're kind of creating a vitamin stew in your urine of vitamin metabolites and vitamin ingredients. So I don't think adding extra vitamin C, even though it is a low acid vitamin C, is a good idea right now. What else are you taking?
The pumpkin seed oil that I don't know if it's helping or not. And then I got some natural aloe vera. But nothing's changed. I'm taking this stuff, but I still got the bloating, the cramping, and the feeling I have to pee all the time.
Well,
so I know I got to get that camera test with the urethra. I probably should go do that, but I'm probably not going to get that done until after March sometime, I guess. I don't know. In the meantime,
but you're not using any of the products that I see patients have consistently used. I don't know that brand of aloe. I've never seen that aloe before. I mean, if you're going to do the aloe, you want to do a recognized brand that's worked with IC. So you're either going to do Desert Harvest aloe or Aloe Path. Do you have any reactions after you take the aloe? Any stomach distress, diarrhea, anything like that?
No, my stomach is always in distress already. So I did have diarrhea. Sorry.
Okay, so then you don't use that aloe. Aloe has to be processed very carefully. They've got to remove something called anthraquinones, which can cause diarrhea and all sorts of stuff like that, and even potentially cause cancer. So both Desert Harvest aloe and Aloe Path use a highly kind of processed aloe that removes those ingredients. So I would,
Okay.
I wouldn't do that. We just don't know right now. We don't know if you're bladder wall driven or pelvic floor driven. When you have a flare, what makes you feel better?
Well, I don't know because it's been months since I've had this, and I have really a flare would be, I guess, like when I feel like I gotta pee really bad all the time. Is
Yeah.
that what you call a flare?
Yeah.
And I think it's when I eat crap. Well, I'm eating a lot of high sugar stuff.
That's okay. It's crap, also known as junk food. We've all done.
But
Well,
it's all it's natural. It's like it's the healthy it's a health food, junk food. You know what I mean?
I know,
I
but
don't eat like I don't eat like artificial. I eat like you go to the health food store and you buy the candy that's in there, it's all natural. You buy the licorice, that's all natural. You buy the chocolate, that's all organic. Or that stuff I eat a lot of.
I know, but you got to lose the chocolate. You can do carob, but you can't do chocolate. You shouldn't be doing chocolate right now. So how old are you?
My 50s, my
Okay.
late 50s.
And when did well, girl, hey, I just turned 60.
Oh, you look good.
Guys, I'm going to be freaking 80 years old in 20 years. That is insane.
I don't want to live to 80, actually. I don't want
in
to go that
this whole
long.
aging thing is so weird because you feel so young inside. It's so weird.
I know. My mind don't think of that number, but I don't. When I hear the number, I get sad. I want to cry. I want to run away.
Well, hey man, I took the Facebook age test and I aged out at 28. So that's my official age, is what Facebook says I am, which is 28
You
years
look
old.
it.
Thank you. Okay, so as we ponder what your subtype can be, the very first thing we have to consider is estrogen atrophy, because you and I are of that age. Yeah. And so are you dry down there? Do you have a dry vulva?
I got the B Magic. I ordered the B Magic.
Okay. And does that help? Does that feel good?
I only used it once. I just got it a couple days ago, but I don't know if I'm dry. I never had that problem. I haven't been physical in over a year and a half with anybody, so I don't know.
Yeah. Yeah. So, but it's a reality. It's happening. We can't turn it off. You know, if I could go back and 45 again, that's like the perfect age. It's like being in your early 40s, perfect age. So we have to consider the quality and health of your skin. That's clearly going to be playing a role. But what we don't know is if your muscles are involved. And so if I were to ask you the question, when is your discomfort the worst? Before you pee or after you're done peeing? How would you answer that question? Does it feel the worst? Is your bladder's filling with pain, or does it feel the worst after you're done peeing?
It's so weird. You asked that question before with other women, and I never know if I feel like it's the same before and after. It's just like I relieve I go pee, and then I'm like, then I feel like I have the urgency still. So I don't know.
Okay. And when you have the urgency, do you find yourself running to the bathroom to reduce pain, or running to the bathroom because you're afraid you're going to leak?
When I have the urgency, I don't run to the bathroom. I just hold it for a little while. And I think I just started leaking last week for the first time. And I felt like I was scared. I thought something was going on with my spine. But he doesn't think it's related to my spine when I saw the doctor.
Well, no, I mean, you're at the age, you're at the age of estrogen atrophy. So the odds are heavily in that direction for you. We just have to rule out some of the other stuff too, right? And so it would be nice to know what's going on with your muscles. It would be, when you have pain, where is your pain located? So again, here's your pelvis, and where's my bladder here? So the bladder would be, wait, hold on. I have to put on my outer muscles. Stay. These have little magnets. They don't often work. Okay, so look, pelvis, here's your pubic bone, and here's your bladder kind of peeking out over your pubic bone. So is your pain and discomfort like right above this pubic bone, or is it over here or over here? Where's your pain?
I don't really feel pain in my pelvic area. Like I feel cramping in my belly, and the pain was bad on my left side. But as far as pain, I don't understand when you say pain, what the pain is feeling. I feel like I got a bloated cramping pain, but
okay, but what? But you just said something about the left side.
Yeah, I used to have pain. I had pain on and off on my lower belly, left side, but no one could figure it out.
So that's why you need. So again, that's not your bladder.
No, but I feel like I have the urgency.
I know, but muscles can cause all that. Muscles can cause urgency, frequency, pressure, pain. You know, they can. So don't assume that because you have urgency that it's just your bladder. It could easily be something else victimizing your bladder. So when you have your pelvic floor assessment, we got to figure out that left side. And you need to be very clear. Don't walk in and say you've got IC. Walk in and say, I'm here because I'm trying to figure out why I have this symptom here. And your ability to describe your symptoms clearly and succinctly and get them to focus on your anatomy. You know, and don't say, hey, I've had a lot of UTIs. Just say, I mean, because we don't want to drop down that old rabbit hole of perception and beliefs about IC. We want specifics. We need them to study your body. And so that pain on the left side is really important to solving your mystery here. And if I were to guess, given your history of back issues, I wouldn't surprise me. Do you have a bad hip on that side or an SI joint?
No, the hip is arthritis, and I have DVT through my whole and sciatica.
Well, it's okay. So you got sciatica. Sciatica is driven by tight pelvic floor muscles.
I thought it was related to my back spine.
No. Sciatica is caused by. So here is. So if we can get to So look, here's your sacrum where I'm pointing, and the nerves come out of the sacrum separately, and then they pass through and over certain structures in the pelvis, including the piriformis muscle and the obturator muscle. So sciatica happens when the piriformis muscle pushes down on the sciatic nerve, or one of the others do. So you have pelvic floor dysfunction.
Cool. And who can I see for that?
Your pelvic floor physical therapist.
Are they covered by insurance with that?
In many cases, they are, yes. Especially if you have a history of sciatica.
Oh, good. So I could just call up my insurance company and see if they have somebody to recommend it?
Yes. Or call your doctor. Who did you work with who diagnosed your sciatica?
Nobody of that. I just related it to the bulging disc in the spine.
Well, I think you need to go. So again, there's a ripple effect of different things that happen. Is the sciatica on one side or the other side? Both sides?
Always on the left side.
And you have pain on your left side. Okay. So I think it's time for you to have a proper orthopedic examination to figure out if it's sciatica or not.
I saw the orthopedic doctor last week, and he said, even though I have the genetic disc and the other thing, one of my discs is not the greatest, he doesn't feel the left side belly pain is related to the spine, but he just went by my last year MRI.
Okay, but did he check your muscles?
No, his assistant did some squeezing and made me, bend my leg. They didn't make me bend or nothing or anything.
Okay, but nobody did a vaginal exam? A finger in your,
No, that was my gyno exam. I had all that done.
Okay. So why don't you ask the orthopedic surgeon that you saw if he would make a referral to a pelvic floor physical therapist to help you with your sciatica symptoms? You just saw him last week.
Send him a message.
Yeah. Yeah, and let's just see. I mean, because it could easily be a tight muscle, and I think you deserve a proper workup. You have not
You
had a proper
recommended
workup.
physical therapy, shots if I wanted, and pain management.
Yeah, but I mean, the secret to pain management is to figure out what's causing the pain. So so the physical therapy is, or at least seeing a physical therapist once for a proper pelvic examination is really important here. Okay.
Yeah, because nobody could tell me why I have the bloaty, the pain in the belly. And do you think you recommend that camera test in the urethra? Because do you recommend that?
Well, if your diagnosis is in doubt, we don't do hydrodistensions for diagnosis anymore unless the diagnosis is in doubt. Why? Because the American Urology Association is trying to minimize trauma to the patients. And they recognize that some of the testing is so painful, or used to be so painful, that patients never went back. So if you read the current guides, it's all about making it comfortable for you. They don't want to traumatize you. And so my position is that if I'm in pain, and if I've been in pain for a long period of time, I want somebody to look at that part of my body to figure out what the hell is wrong. And so at some point in time, it's important to let somebody look. Because for all we know, maybe you've got a bladder stone, or maybe you've got a lesion or something. If this has gone on, I mean, so today, if you were to go to a top tier IC specialist or doctor today, at the first appointment, they would do a history, they would do a physical exam, they would do a vaginal exam to look at your muscles, and if nothing, they would do urine testing. And if nothing popped out at them, the odds are they would give you the diet, they would refer you to pelvic floor physical therapy, and they might suggest Elmeron or a bladder installation, or more appropriately, some of the supplements. And they would say, come back in 3 months or 6 months and see how you're doing. And if you've legitimately done that and you're not improving, that's when they would say, okay, let's look in your bladder and see if we've missed something.
So the last urologist I saw recommended Elmeron, and I don't want to take it, I'm afraid. And then she recommended the camera test.
Well, so again, letting somebody look is important. Now, Rebecca says here, thank you. I'm currently doing physical therapy for pelvic floor and just finished doing 5 rounds of bladder installations, and they didn't seem to help. My pain actually got worse with the bladder installations. Interesting. Okay. So, I like data. I like facts. And I've told the story several times of a patient who was afraid of the testing for years, and she suffered for years. And when she finally let them look in her bladder, what did they find? A bladder stone floating around in her urine, cutting her bladder, because stones are very sharp. Once they removed the stone, what do you think happened? Her symptoms resolved completely. Her bladder healed, life went on. So she let fear stop her for 5 years, and they could have found something very, very easy to treat. It was very easy to treat once they found it. So if you're worried, if you're not changing at all, I think that it's perfectly justified to have a cystoscopy and to have a pelvic floor assessment. And then they will both give you facts. The pelvic floor will say, yeah, man, you're hella tight on the left side. We should do something about that. And for all we know, the cystoscopy might be, you know what, your bladder looks great. And if that's the case, you can let that worry go. And now we know where to work, which is going to be on the muscles. Right?
Okay. Thank you so much.
Okay, hon. Well, listen, don't let fear stop you. Let's just have a good, reasonable plan. You don't have to jump to bladder removal. And that's what a lot of people do. You get so desperate, you just go for the worst.
Oh, I would do that.
And we've had patients who've had their bladders removed, only discover after the fact it was never their bladder, it was their muscles. or a fibroid tumor or whatever. So you carry hope in your heart, my friend. Okay.
Thank you too.
Okay,
Bye.
hon. Bye-bye. All
Bye.
right. We're going to go to, let's see. Cindy, I did you, right? I did you already. Okay. Linnea. Okay. Our last person is going to be Linnea. How are you, Linnea? How are you? Long time no see.
Hi, I know, a long time no see. I'm okay. I'm just checking in to say hi and I'm still alive and well.
Excellent. Excellent.
I have my moments, but I take my pre-leaf and it's like almost true confessions. Oh, I ate some chocolate.
Mm-hmm. Yes.
My friends bring me food. I don't go to the stores, and people forget, no gluten, no chocolate, and somebody brought me these flax muffins, and they were just sitting there, and there's nothing other treats in the house, and I just...
Yeah. Well, I mean, we got to be real. This is a crazy time in our lives, and
it's a crazy time. And chocolate, I'm pretty sure, is an essential vitamin.
Yeah. I like carob. You know what I like carob? I was reading, I wrote an article on chocolate on carob, a blog on our website, and it said that carob had fiber in it. And I thought, there you go. All right, now I can do my carob. I can do a little bit of carob every day. And so I bought carob chips. And yeah, man, I have like a tablespoon or two at night
I'm
after
a member
dinner.
of the food co-op in my town, and I should try to see if I can order from them.
Oh, you should. The carob
in fact, I just
really
put
good.
in my first order to have it delivered today, and I'll go back. It said it's not too late to add to your order. I'll go back and I'll see if I can add some carob to that, so that I can have some kind of, because if it's not sex, drugs, and rock and roll, what is left but chocolate?
Carob.
Carob, okay.
Carob. All right, hon. Yeah. Well, you look beautiful. You look like you're doing well and thriving despite this crazy time. So keep it up. All right, you guys. Any last questions? Linnea, thank you for hanging around and checking in and telling me how you're doing. I really appreciate that. All right, you guys. For everybody on Zoom, we're gonna shut it down. It is 3:39. We're gonna come back to Facebook and YouTube.
Bye. Thank you.
Bye-bye, you guys. All right. Zoom is done. Let me move that there. Let me move that there. We can shut that there. Let me set up my computer here. All right, guys. Tanya says negative thoughts cause my heart to race. Sure. Well, you're in anxiety, hon. And biologically, what that means is your sympathetic nervous system is on overdrive trying to save your life. And one of the ways it tries to do that, because your brain thinks you've got to fight or flee. And so it's raising your heart rate. It's raising your blood pressure. It's tightening your muscles because your brain thinks your life is at stake. And so that's why we got to balance that with positivity, right? Remember, pain accompanied by anxiety, pain that's accompanied by laughter will be minimized. Got to work on controlling that anxiety. Counteract your negative thoughts with positive thoughts. Focus on the positive. I mean, look, you see my office here, right? I've got believe. I've got love there. I've got love there. I've got cats. I've got butterflies. I got birds. This is the happiest room ever. I live in a happy place. I have to live in a happy place to kind of get through kind of the challenge that we have, not only physically, but also, with running the IC network and caring for so many people. At the end of the day, some days I'm on the phone for 6, 7, 8 hours, and it can take a toll. And so I have to counteract that. And I counteract that by living in a very happy home with a lot of happy things around me. And then I also go kill things playing computer games when I get really stressed out. World of Warcraft. Yeah. Hunter. I'm a hunter. Yes, I'm a hunter. I have pets. I have a great lion pet and a tiger pet that I use. All right. All right, guys, listen, you got me here. Any last questions? I'm happy to take a few more questions if you've got them. Otherwise, let me open my basket of goodies here. Let me see. Oh my God. I got to do that. I'm going to have to do this next time. Brand new product. So excited. So excited. Natural Approach to Nutrition has a brand new product called My Daily D-Manos that we're going to be carrying. Really excited about that. We also have a Flare Guard product, a flare product that they're working on, and a couple of other things. Amazing company. They also make Bladder Builder and Bladder Rest and Piora. They're dedicated to the cause. What else do I have in here? Do I have anything else in here? You know, I always like to give freebies away. And here's the deal. Some of you are so sensitive that even shampoo irritates you. And so I don't have them up in my store yet. I ordered these a couple months ago. I love this company. These are the products. This is the conditioner that I use for my hair. Morning, Earth Science Olive and Avocado Hair Mask. This stuff is amazing. And I also got this fragrance-free, extra gentle shampoo and conditioner for people who are sensitive. And so here's your freebie. I would be happy to send a shampoo and a conditioner to someone who is struggling because of chemical sensitivity. If you would like a free Earth Science fragrance-free shampoo and fragrance-free conditioner, all you need to do is email me, icnetwork@mac.com, icnetwork@mac, M as in Mary, A as in Apple, C as in Charlie.com. And I'll throw in one of these for somebody too, because I've got 4 of these. So if anybody has really, you know, kind of thicker hair and you're really struggling, if you would like to try a hair mask, I will be happy to send this to you. So you have to email me, icnetwork@mac, M as in Mary, A as in Apple, C as in Charlie.com. Hey, Rebecca on YouTube. So you're doing physical therapy for pelvic floor. You're also doing, you just finished 5 rounds of bladder installations and they didn't seem to help. What were the bladder installations? I'm curious as to what they were. Because some bladder installations will definitely make it worse. So hopefully it wasn't chlorpactin or silver nitrate or something like that. Yikes, 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 yikes. All right, last call for questions. Last call for questions. Anybody? Otherwise, I've got to go do my pelvic floor for my back. So, I mean, my physical therapy for my back. All right. I tell you what, I wish you a fantastic week. Let me give you your homework. For 15 minutes a day, I need you to do something to give your spirit some comfort, whether that is going to church, sitting out in the sunshine, walking in the redwoods, reading your Bible, reading a romance novel, whatever will give you comfort. 15 minutes a day, do it. For 15 minutes a day, I need you to do something for your bladder or your pelvic floor. So get down on the floor and do your exercises and stretches like you're supposed to. For 15 minutes a day, I need you to do something for your noggin. Come on, read. Please, for God's sake, let's get that knowledge level up so that you can walk into your doctor's appointments and take control. You need to walk in ahead of time, knowing what your treatment options are and knowing what questions to ask. And then for 15 minutes a day, I need you to laugh hard, belly, gut-wrenching laughs. Because when you laugh, your brain minimizes pain, all right? SPK on YouTube says, I don't know if my pelvic floor is weak or tight. If your pelvic floor is weak, you're going to be incontinent. If your pelvic floor is tight, you're not going to be able to pee. If your pelvic floor is weak, you'll be able to have sex, but if your pelvic floor is tight, intercourse, putting something inside your vagina would be painful. Rebecca says, if my IC is worse around my period, could it be hormone related? I'm fairly young and the symptoms started when I was 21. Yeah, Rebecca, remember we had, and also birth control, hon. If you started birth control, that could explain it too. Yeah, SPK says tight it is. Yep. So, normally girls will start using birth control, in their late teens, early 20s. And we now know we have a good published case study that showed that one young 18-year-old, within 2 weeks of starting an oral birth control, developed IC symptoms. And it took a year before finally somebody asked her if she'd started birth control. And when she did, they went, oh, stop it. And it took about 2 months. But when she stopped the birth control, all of her symptoms went away. Rebecca said they said it was a combination of steroids, lidocaine, antihistamines, maybe something else. Well, I mean, normally with a rescue installation with the lidocaine, you should feel better. Normally, after you have a lidocaine installation, a rescue installation, you're pain-free for a couple of hours. So the fact that you had the installation and you felt pain afterwards says that you're reacting to something in it. Some people are sensitive to lidocaine. They can't do lidocaine. They have to do Marcaine instead. Lidocaine is a short-term anesthetic. Marcaine is a long-term anesthetic. So if you feel that you're worse rather than better, then it's time to take a step back and reconsider your options. And I would really also, Rebecca, listen, at your age, hon, so young, I would really want to check your pelvic floor. I would want to make sure that you do not have an underlying pelvic floor dysfunction going on. Because again, when we kind of look in context, especially for the people where it starts at a younger age, we always want to consider the concept of injury or trauma falling on your tailbone, which is so common in kids and teenagers. And if you were a dancer, if you were an athlete, ice skater, gymnast, anything at all like that, then that could be playing a role too. All right. Okay, my friends, I'm going to end this here. I wish you well. I will hopefully see you next Sunday. And thank you for your feedback on the internet. We will. Hey, and actually, you know what? Facebook, I'm not going to turn you off. YouTube, I'm going to turn you off. Okay, so I'm going to say goodbye to YouTube. Facebook, I'm going to go turn on the TV. And I want to see if it starts freezing. Could you do me a favor and just hang out for a minute? I'll be right back. All right. Goodbye, YouTube.